The lieutenant's voice echoed through the emergency room, dripping with contempt. You don't belong here. What? Claire Whitmore stood in her scrubs, hands steady at her sides, saying nothing. Around her, nurses whispered. Doctors turned away. No one intervened. Ethan Cole, decorated, confident, untouchable, leaned closer, his smirk sharp enough to cut. Were you even qualified for this job, or did someone feel sorry for you? The words hung in the air like smoke. Claire's face remained blank, unreadable. She didn't flinch, didn't defend herself, just stood there, absorbing it all. Behind her, the heart monitor beeped steadily. A trauma bay sat prepped and waiting. Supplies lined up with military precision. No one noticed. Cole kept talking. Claire kept preparing. What he didn't know, what none of them knew, was that the chaos hadn't started yet. But when it did, the woman he just humiliated would be the only one left standing. If you want to see how this story ends, how the quiet ones always win, stay with me until the final word. Like this video, drop a comment with your city so I can see how far this story travels, and let's watch arrogance get what it deserves. The afternoon shift at Redwood City Medical Center started like any other, routine, predictable, forgettable. Claire Whitmore clocked in at 2:47 p.m., 3 minutes before her scheduled start. She tied her hair back, clipped her ID badge to her scrubs, and walked into the emergency department without a word. The fluorescent lights buzzed overhead, the smell of antiseptic mixed with stale coffee. Somewhere in the back, a phone rang unanswered. She didn't expect trouble. She never did. But trouble had a way of finding her anyway. The emergency department was understaffed that day. 2 nurses had called in sick, and the weekend shift supervisor had quit the week before without notice. That left Claire, Tessa Martinez, Karen Holloway, and a rotating cast of residents who looked like they hadn't slept in days. Dr. Miles Harmon, the attending physician, spent most of his time in his office doing paperwork, emerging only when absolutely necessary. The place ran on fumes and caffeine, held together by people too tired to complain. Claire didn't mind. She preferred the quiet chaos. It meant fewer questions, fewer people trying to make small talk or dig into her past. She could do her job, clock out, and go home to her 1-bedroom apartment where the only sound was the hum of the refrigerator and the occasional siren passing on the street below. She was refilling medication carts when Tessa appeared at her elbow, eyes wide with something between excitement and anxiety. "Did you hear?" Tessa whispered, glancing over her shoulder like she was sharing classified information. Claire didn't look up from the vials she was counting. "Hear what?" "There's a lieutenant coming in, from Fort Brennan, some kind of VIP eval before deployment." "Okay? Okay? That's it?" Tessa leaned against the cart. "Claire, he's got like 1,000,000 medals." Karen looked him up. He was in Afghanistan, Iraq, all over. He's kind of a big deal. Claire capped a vial of morphine and locked the cart. "He bleeds the same as everyone else." "You're so weird sometimes." "I know." Tessa laughed, shaking her head. "Well, just so you know, he's supposed to be here at 3:15. Dr. Harmon is all nervous about it. You know how he gets with military people." Claire knew. Harmon had been a civilian doctor his entire career, never served, and he had this odd deference toward anyone in uniform, like they were a different species, untouchable. It made him awkward during veteran intakes, overly formal, trying too hard. "I'll handle it," Claire said. "You sure? He might be—" "I'm sure." Tessa shrugged and walked away, already pulling her phone out to text someone. Claire returned to her tasks, methodical and precise. She restocked gauze, checked IV supplies, verified that the trauma bays had the correct equipment, everything in its place, everything ready. At 3:02 p.m., the doors opened. Lieutenant Ethan Cole walked in like he owned the building. He was tall, broad-shouldered, mid-30s with sharp features and eyes that constantly scanned, assessed, categorized. His uniform was immaculate. Pressed creases, polished brass, ribbons arranged in perfect rows across his chest. Behind him came 2 junior officers, both younger, both standing slightly too straight, like they were perpetually at attention. Claire was at the nurse's station, reviewing a patient chart. She heard the doors, heard the boots on tile, but didn't look up. Not yet. Cole approached the desk. He didn't wait for her to acknowledge him. "I need to be processed. Now." Claire finished writing her note, capped the pen, and glanced up. "Bay 4. Nurse Grayson will take your vitals in a moment." "A moment?" Cole's eyebrow arched. "I don't have time to wait around. Do you know who I am?" "Yes, sir. You're scheduled for 3:15. It's 3:02. His jaw tightened just slightly. "I don't care what the schedule says. Get me in now." Claire met his gaze, her expression neutral. "Bay 4. Nurse Grayson will be with you shortly." For a second, Cole just stared at her, like he was waiting for her to blink, to apologize, to scramble. When she didn't, something shifted in his face. Not quite anger, something colder. He turned to one of the officers beside him and muttered, just loud enough for her to hear, "Unbelievable, they'll hire anyone these days." Claire set the chart down and returned to her work. She didn't react, didn't defend herself. That only made it worse. Cole didn't drop it. He leaned against the counter, arms crossed, watching her like she was a specimen under glass. "You former military?" he asked. She didn't look up. "Yes, sir." "What branch?" "Army." "Doing what? Filing paperwork?" One of the nearby nurses, Tessa, glanced over, her face uncertain. She opened her mouth like she wanted to say something, then thought better of it and turned away. Karen, standing near the supply closet, went very still. Claire's pen kept moving. "I was a medic. A medic." Cole's smile widened, sharp and mocking. "So you handed out Band-Aids and ice packs. Got it. Something like that. Must have been nice. Cushy job. Safe." Claire set the pen down, slowly this time. She looked at him, expression still neutral, voice calm. "Is there something else I can help you with, Lieutenant?" "Yeah, you can move faster. This isn't a charity ward. People here actually depend on efficiency." Tessa's eyes darted between them. Karen took a step closer but said nothing. Dr. Harmon emerged from his office, saw what was happening, and froze in the doorway. He looked like he wanted to intervene, but he didn't. No one did. Cole straightened, adjusting his uniform. "You know what your problem is? You don't respect authority. You sit there like you've got all the time in the world, while people like me, people who actually serve, have to wait." Claire's hands rested flat on the counter. Her breathing didn't change. "Bay 4, Lieutenant. Nurse Grayson is ready for you now." He stared at her a moment longer, then turned on his heel and walked away, his boots clicking sharply against the tile. The two officers followed, one of them glancing back at Claire with something like curiosity. Tessa exhaled, her breath shaky. "Why do you let him talk to you like that?" Claire picked up her chart again. "Because it doesn't matter. It matters to me." "Then you'll have a harder time here than I will." Karen shook her head, lips pressed into a thin line. "He's a piece of work." "He's scared," Claire said quietly. "Scared?" Tessa blinked. "Of what?" Claire didn't answer. She just turned and walked toward the supply room, her steps measured and deliberate. Behind her, the ER continued its steady hum, phones ringing, monitors beeping, the low murmur of patients waiting in curtained bays. Dr. Harmon finally approached, his face tight with something between guilt and frustration. "Claire, I go..." "It's fine, Dr. Harmon. It's not fine. I should have said something." "Why?" She stopped, genuinely curious. "Would it have changed anything?" He hesitated, searching for words that didn't come. Finally, he just shook his head and walked away. Claire disappeared into the supply room. The door clicked shut behind her. For a moment, she just stood there in the dim light, surrounded by shelves of bandages and antiseptic and IV bags. Her hands were steady. Her breathing was even. But her eyes were somewhere else, somewhere far away. She'd been there before. The humiliation, the dismissal, the assumption that quiet meant weak, that calm meant incompetent. She'd learned a long time ago that the loudest person in the room was rarely the most dangerous. 30 minutes passed. Cole finished his evaluation and returned to the waiting area, still in uniform, still radiating irritation. He stood near the intake desk, texting on his phone, occasionally glancing up at the clock. His presence was a weight in the room, unspoken but felt. Claire was restocking Trauma Bay 3 when he approached her again. "Hey." She turned, holding a stack of gauze pads. "Yes, sir?" "I need a copy of my records for my file." "Medical records are handled on the second floor. Window opens at 4. "I don't have time to go upstairs. Just print them here." "I don't have access to that system." Cole's eyes narrowed. "You're a nurse. Of course you have access." "I have access to patient care systems. Medical records is a separate department." "Then find someone who does." Claire set the gauze down, her movements slow and deliberate. "Lieutenant, I understand you're in a hurry, but hospital protocol requires you to request records through the appropriate..." "I don't care about protocol. I care about getting what I need and getting out of here. You're standing there doing nothing. Make yourself useful." "Oh, Tessa, passing by with an IV pole, stopped mid-step. Dr. Harmon looked up from a chart across the room. Even the patient in Bay 2, a middle-aged man with a sprained wrist, went quiet, pretending not to listen. Claire's voice didn't rise, didn't waver. "I'll call records and let them know you're on your way." "You'll do it now." "No, sir, I won't." The silence was instant, sharp-edged. Cole's expression darkened. "Excuse me?" I said I won't because it's not my job, and I don't have the clearance. If you'd like to file a complaint, the patient advocate's office is on the first floor. Cole stepped closer. Not threatening, exactly, but deliberate, intentional. You've got a real attitude problem, you know that? What? I've been told. You think because you wore a uniform once, that makes you special? No, sir. Then act like it, because right now you're embarrassing yourself. Claire met his gaze, calm and unyielding. I'll make the call for you. Lieutenant, records will have everything ready when you get there. For a moment, Cole just stood there, jaw working, eyes flashing. Then he turned and walked away without another word. Tessa exhaled shakily. Claire, it's fine. It's not fine. He's awful. He's scared, Claire repeated. Scared people lash out. That's all this is. What's he scared of? Claire didn't answer. She just picked up the gauze and continued restocking, her movements precise and unhurried. Karen appeared at her side a few minutes later, voice low. You want me to talk to Harmon? File something? No. Claire, he can't just... He can, and he did, and it doesn't change anything. It changes how people see you. Claire paused, gauze in hand, and looked at Karen directly. The people who matter already know. The ones who don't never will. Filing a complaint won't fix that. Karen sighed, but she didn't push. She knew Claire well enough by now to recognize when the conversation was over. The rest of the hour passed in relative quiet. Cole left for the records office. The ER settled back into its rhythm, slow, steady, manageable. A few minor cases trickled in. A kid with a possible fracture. An elderly woman with chest pain that turned out to be indigestion. A college student who'd had too much to drink and needed to sleep it off. Claire moved through it all with the same calm efficiency. She checked vitals, started IVs, reassured patients, coordinated with doctors. She didn't speak unless necessary. Didn't smile unless it served a purpose. She was a ghost in scrubs, there and not there, essential but invisible. At 4:17 p.m., everything changed. The ER's double doors burst open with a violent crash, metal slamming against rubber stoppers hard enough to make everyone jump. Heads turned, conversations stopped. A gurney rushed in, flanked by paramedics in blood-streaked uniforms. Behind them, another gurney, then another. Voices overlapped, frantic and clipped. GSW to the abdomen, unresponsive. Chest trauma, possible, hemothorax. Multiple lacerations, BP dropping fast. The paramedics didn't stop moving. They didn't wait for direction. They just flooded in, shouting vitals, calling for doctors, dragging the gurneys toward empty bays. Dr. Harmon emerged from his office, face pale. What the hell happened? Armed convoy got hit downtown. One of the paramedics, a stocky man named Ramos, said as he pushed past. Explosion, then gunfire. We've got at least 6 critical coming in hot. Maybe more. The ER erupted into chaos. Nurses scrambled. Residents shouted for equipment. Harmon barked orders, but his voice was drowned out by overlapping conversations, alarms, the screech of gurney wheels on tile. Someone knocked over a tray of instruments. Someone else yelled for O-negative blood. The overhead intercom crackled. Trauma team to ER, trauma team to ER. But the words barely registered over the noise. Claire didn't move. Not yet. She stood near Bay 3, watching, assessing. Her eyes tracked every gurney, every injury, every bottleneck forming in real time. Her breathing stayed even, her hands stayed loose at her sides. Then she stepped forward. Bay 3, she said. Her voice wasn't loud, but it cut through the noise like a blade. Move the GSW here. Tessa, get a trauma cart. Karen, I need 2 units of O-neg and a chest tube kit. Now. Tessa froze, wide-eyed. But Dr. Harmon is handling Bay 1. Move. Tessa moved. The GSW patient, a man in his 30s, pale and barely breathing, was wheeled into Bay 3. Claire was already gloved, mask on, standing at the head of the bed. Her hands moved fast but controlled, checking airway, palpating the abdomen, calling out findings like she was reading a script she'd memorized years ago. Respiratory rate shallow, 14 per minute, abdomen rigid, distended, likely internal bleed. Ramos, what's his pressure? 80 over 50 and dropping. Start a second line, wide open. Get me surgical on the phone. Dr. Harmon appeared at her side, breathless, eyes wide. Claire, what are you... Saving his life, you've got 2 more incoming, Bay 4 and 5, go. He stared at her for half a second, then turned and ran. Claire worked, no hesitation, no wasted movement. She placed the second IV line in under 10 seconds, started fluids, prepped the ultrasound probe. Tessa handed her the chest tube kit without being asked, hands shaking but functional. Good, Claire said quietly. Stay with me. You're doing fine. Tessa nodded, swallowing hard. The next patient arrived, a woman in her 20s, conscious but bleeding heavily from a deep laceration across her shoulder and neck. Claire glanced over, eyes sharp, assessing in a fraction of a second. Bay 2. Karen, pressure dressing and get her typed. She's stable but needs sutures, fast. Karen hesitated. Shouldn't we wait for... She's stable. The others aren't. Go. Karen went. Another patient crashed through the doors, then another. The ER transformed into a war zone, blood on the floor, voices shouting, the metallic smell of trauma thick in the air. Residents stumbled over each other. A nurse dropped a bag of saline and it exploded across the tile. Dr. Harmon was trying to coordinate, but his voice kept getting lost in the noise. Claire moved between bays like she was conducting an orchestra, calm, precise, always 3 steps ahead. She didn't raise her voice, didn't bark orders, but everyone obeyed. There was something in her tone, in the way she moved, that made disobedience unthinkable. Lieutenant Cole was still in the waiting area, phone in hand, when the 4th gurney came through. This one was different. The patient wasn't moving, wasn't breathing. The paramedic doing chest compressions looked exhausted, sweat pouring down his face, arms shaking with effort. Full arrest, he gasped. Lost pulse 2 minutes ago. We've been working him the whole ride. Dr. Harmon's face went white. Get him to Bay 6. No. Claire's voice stopped him cold. Bay 3. Tessa, clear it. Now. The GSW patient was already being wheeled toward the elevator, surgical team taking over. Tessa wiped down the bed in seconds flat, hands moving on autopilot. The arrest patient was transferred in. Claire was there before the gurney even stopped rolling. How long down total? 4 minutes? Maybe 5. Rhythm? V-fib when we lost him. Shocked twice already. No response. Charge to 200. Everyone clear. The defibrillator whined, building charge. Claire placed the paddles with practiced precision, eyes locked on the monitor. The line danced erratically, then flattened into chaos. Clear. The body jerked. The line stayed flat. Again, 300. Claire, Harmon started, his voice uncertain. Again. The second shock. Nothing, just the same chaotic flatline. Claire didn't hesitate. Push epi. 1 milligram. I've got airway. She grabbed the intubation kit, positioned herself at the head of the bed. Her hands moved in one smooth, practiced motion, laryngoscope in, vocal cords visualized, tube placed, no fumbling, no second tries. She'd done this so many times the movements were muscle memory. Bagging. Tessa. Compressions. Hard and fast. Don't stop. Tessa positioned herself over the patient's chest, laced her fingers, and started compressions. Her form was good, elbows locked, shoulders over hands, pressing deep. Claire's eyes stayed on the monitor, watching, counting, calculating. 30 seconds. 40. The room held its breath. Even the chaos seemed to pause, like the entire ER was waiting for this one heart to decide whether to beat. Then, a blip, a single, weak contraction. There, Claire said, her voice steady. Keep going, don't stop. Another beat, then another. A rhythm started to form, fragile and uneven, but real. Harmon stared at the monitor, disbelief written across his face. You got him back. He's not stable yet. We need to move him to ICU. Now. Tessa, keep bagging. Karen, call upstairs and tell them we're coming. They moved as one unit, the patient surrounded by people who, moments ago, had been scattered and panicking. Now they moved with purpose, with coordination, because Claire had given them that. The ER was still chaos, but now it was controlled chaos. Organized. Functional. Patients were being triaged, treated, stabilized. The initial wave of panic had broken against Claire's calm like water against stone. She stood in the center of it all, pulling off her bloody gloves, mask hanging around her neck. Her scrubs were splattered with blood. Her hair had come loose from its tie, but her breathing was steady. Her hands weren't shaking. That's when the doors opened again. Not paramedics this time. Armed military personnel. 6 of them, moving in tight formation, rifles slung low across their chests. They wore combat uniforms, tactical vests, helmets with visors down. Their movements were precise, practiced, clearing angles, scanning the room with the kind of vigilance that only came from active combat experience. Everyone froze. A nurse dropped a clipboard. A patient in the waiting area stood up, eyes wide. Doctor. Harmon took a step forward, hands raised slightly. What's going on? This is a hospital. The soldiers didn't respond. They fanned out, taking positions near the exits, near the trauma bays, creating a perimeter. Behind them, a senior officer stepped through the doors. A colonel, judging by the insignia on his uniform. He was older, maybe late 40s, With close-cropped gray hair and a face carved from granite, his eyes swept the ER methodically, professionally. Then they stopped. On Claire. He walked toward her, boots echoing in the sudden oppressive silence. The other soldiers held their positions, hands near their weapons. Not threatening, just ready. Lieutenant Cole, still standing near the intake desk, straightened. Confusion flickered across his face, then something harder. He stepped forward. "Colonel, I'm Lieutenant Ethan Cole, Fort Brennan. What's the situation here? Do you need—" The colonel walked past him without a word, like he wasn't even there. Cole's face flushed. "Sir, I—" "Stand down, Lieutenant." Cole's mouth snapped shut. The colonel stopped in front of Claire. She didn't move, didn't step back, didn't look surprised. She just stood there, blood on her scrubs, exhaustion in the lines around her eyes, and met his gaze with that same unreadable calm. "Ma'am," the colonel said, and then he saluted. The entire ER went silent. Not just quiet, silent. The kind of silence that has weight, that presses down on your chest and makes it hard to breathe. Tessa's eyes went wide. Karen's hand flew to her mouth. Dr. Harmon looked like someone had just rewritten the laws of physics in front of him. Lieutenant Cole stood frozen, his face draining of color. Claire didn't salute back, she just nodded once. "Colonel Reeves?" "Captain Whitmore." His voice was formal, respectful. "We received word that you were on site during the convoy incident response." "I was." "Command sent us to secure the area and provide escort if needed. We weren't aware you were." He glanced around the ER, at the blood, the chaos, the patient still being treated. "In the middle of active trauma management. It's handled. I can see that." Reeves lowered his salute, but his posture remained formal, respectful. "Do you require additional medical personnel? We can have a team here in 15 minutes. We're managing. But if you've got a trauma surgeon in your unit, Bay 1 could use the help." "Done." Reeves turned to one of the soldiers. "Get Captain Torres on the line. Tell him we need him at Redwood City Medical, Trauma Bay 1, immediately." The soldier nodded and spoke quietly into his radio. Reeves turned back to Claire. "Anything else?" "We'll need blood. At least 10 more units of O negative. And if you've got field supplies, chest tubes, intubation kits, combat gauze, we could use them. Consider it done." He nodded once more, then stepped back and gestured to his team. They moved with the same silent efficiency, already coordinating, already making calls. Within seconds, the military presence had shifted from intimidating to instrumental. Claire turned back to the trauma bay, ready to continue working. But Lieutenant Cole wasn't done. "Wait." His voice cracked slightly. He stepped forward, looking between Claire and the colonel. "What the hell is going on? Who is she?" Reeves looked at him, and there was no warmth in his eyes. "That's Captain Claire Whitmore, former Special Operations Combat Medic. Tier 1 attachment. 3 combat deployments. Over 200 confirmed saves under fire." Cole's face went slack. That's not possible. She's a nurse." "She's a lot more than that, Lieutenant." Reeves's tone was ice. "And I suggest you show some respect." She never said—" "She doesn't have to." Reeves stepped closer, and though he was shorter than Cole, he somehow seemed to tower over him. You see, that's the difference between someone who's actually been in combat and someone who wears the uniform for show. Real operators don't need to announce who they are. They just do the work. Cole opened his mouth, closed it, opened it again. No words came. Tessa was staring at Claire like she'd just sprouted wings. "You were Special Operations?" Claire didn't look up from the medication she was preparing. "It was a long time ago." "How long?" "Long enough." Karen stepped closer, her voice quiet. "Why didn't you tell anyone?" "Because it doesn't matter." "It matters now, ma'am," Dr. Harmon said, his voice shaking slightly. "Claire, if we'd known—" "You'd have what? Treated me differently?" "That's exactly why I didn't say anything." She capped the syringe and turned to face them, and for the first time there was a hint of something sharp in her expression. "I left that life behind. I came here to do a job. The same job you all do. I don't need special treatment. I don't need recognition. I just need to help people." "But he—" Tessa gestured toward Cole, who looked like he wanted the floor to open up and swallow him. "He was so awful to you. He was scared and ignorant. That's not a crime." "It should be," Karen muttered. Colonel Reeves cleared his throat. "Captain Whitmore, I need to inform you that due to the nature of the incident downtown and your involvement in the response, there will be a formal inquiry. Standard protocol. I'll need a preliminary statement when you're available. I'll make time. And—" Reeves hesitated just slightly. "Command would like to know if you'd consider consulting on trauma response protocols. Given your experience, your insight would be valuable." "I'll think about it." That's all I can ask. He nodded once more, then turned to his team. Let's move. Get those supplies here. Torres is 10 minutes out. The soldiers moved with silent efficiency, and within moments, the military presence became a support system rather than an intrusion. Supplies started arriving. A trauma surgeon, Captain Torres, showed up in full gear and immediately scrubbed in to help with the most critical patient. The ER transformed. What had been chaos became a well-oiled machine, military precision meeting medical expertise. And at the center of it all, Claire Whitmore continued working, her movements calm and deliberate, like nothing had changed. But everything had. Lieutenant Cole stood near the wall, watching, his earlier arrogance completely evaporated. He looked smaller now, diminished. One of the junior officers who'd come with him approached, voice low. Sir, should we— Shut up, Cole said quietly. Just shut up. Tessa was still staring at Claire, awe and confusion warring on her face. I can't believe you never said anything. There was nothing to say. Are you kidding? You're a war hero. I'm a nurse. Claire's voice was firm. That's all I am now. That's all I want to be. Karen shook her head slowly. I don't think you get to decide that anymore. Why not? Because that colonel just saluted you in front of everyone. Because word is going to spread. Because— Karen gestured around the ER. Because you just saved 6 lives in under an hour and made it look easy. It wasn't easy. But you made it look like it was. That's the point. Claire didn't respond. She just continued her work, checking vitals, updating charts, coordinating with the incoming surgical teams. But there was a tension in her shoulders that hadn't been there before. A tightness around her eyes. Dr. Harmon approached, his face a mixture of guilt and something that might have been shame. Claire, I owe you an apology. You don't. I do. I should have stepped in earlier. When Lieutenant Cole was, it wouldn't have mattered. Maybe not to you, but it matters to me. Harmon's voice cracked slightly. I've been watching you work for 3 months. I knew you were good. I didn't know you were— this. I'm the same person I was this morning. No, you're not. Harmon looked around the ER, at the organized chaos, at the lives being saved. Or maybe you are, and I just never bothered to look closely enough. Before Claire could respond, one of the trauma patients, the woman with the shoulder laceration, called out from Bay 2. Nurse, I'm feeling dizzy. Claire was there in seconds, checking her blood pressure, adjusting her IV. You're okay. Just a little drop in pressure. We're getting you more fluids. Stay with me. The woman nodded, her eyes unfocused but trusting. Claire worked quietly, efficiently, making small adjustments, murmuring reassurance, the same way she'd been doing all day. The same way she'd probably done in a dozen war zones, surrounded by gunfire and explosions instead of beeping monitors and fluorescent lights. Lieutenant Cole watched from across the room, and something in his expression had shifted. The arrogance was gone. What remained looked uncomfortably close to horror. Not at the injuries, not at the blood, at himself. One of the junior officers approached him again. Sir, should we head back to base? Our eval is done, and— No. Cole's voice was hollow. We wait. For what? For me to figure out how to apologize. The officer blinked. Sir? You heard me. By 5:30 p.m., the initial wave of critical patients had been stabilized. 4 were in surgery. 2 were in the ICU. The rest were being monitored, stable enough to wait for OR time. The ER had returned to something resembling normal, though the floor was still streaked with blood and discarded supplies. Claire was washing her hands at the scrub sink when Tessa approached, tentative. Hey. Claire glanced over. Yeah? I wanted to say thank you. For earlier. When I was doing compressions, I thought I was going to lose it, but you kept me steady. You did that yourself. I did it because you were there. Tessa hesitated. Can I ask you something? Sure. Why'd you leave? The military, I mean. If you were that good, why come here and do this? Claire dried her hands slowly, deliberately. For a long moment, she didn't answer. Then quietly, because I got tired of putting people back together just so they could go out and get broken again. Tessa's eyes widened. Oh, here, when I save someone, they get to go home. They get to go back to their lives. They don't get sent back into a combat zone 3 weeks later. Claire tossed the paper towel into the trash. It's a better ending. Is it enough? After everything you did? It has to be. Tessa nodded slowly. Then, impulsively, she hugged Claire, quick and tight, before stepping back, embarrassed. Sorry, it's okay. Tessa left, wiping her eyes. Claire stood alone at the sink, staring at her reflection in the small mirror. She looked tired, older than her 34 years. There was blood on her collar, a smudge of it on her cheek that she'd missed. She wiped it away and headed back to the floor. Lieutenant Cole was waiting near the nurse's station. He stood when he saw her, posture rigid, face pale. Captain Whitmore, it's just Claire now. He struggled with the words, jaw working. I need to apologize. You don't? I do. His voice was tight. I was out of line. Multiple times. I disrespected you. I questioned your competence. I made assumptions based on... He stopped, swallowed. Based on nothing. And I was wrong. Claire looked at him, her expression unreadable. Okay. That's it? Just okay? What do you want me to say? I don't know. That you accept my apology? That you... Cole ran a hand through his hair, frustration and shame mixing in his voice. I just watched you save 6 people's lives. I watched a colonel salute you. And all I could think about was every shitty thing I said to you today. So don't say it again. I won't. To anyone. Cole's eyes met hers and he nodded. To anyone. Then we're done here. She started to walk away, but Cole's voice stopped her. Can I ask you something? She turned back, waiting. Why didn't you tell me? When I was being an ass, why didn't you just say who you were? Claire's expression didn't change. Because my value doesn't come from my past. It comes from what I do right now, in this moment. If I have to pull out a resume to get respect, then the respect isn't real. Cole absorbed that, nodded slowly. I understand. Do you? I'm starting to. Claire turned and walked away. The rest of the shift passed in a blur. More patients came in, minor cases now, the usual evening rush. Claire treated them all with the same calm efficiency. By the time 8 p.m. rolled around, she was ready to clock out. She was pulling off her scrubs in the locker room when Karen appeared. You leaving? Shift's over. You could stay. I'm sure Harmon would approve overtime after what you did today. I've done enough. Karen hesitated, then sat down on the bench across from Claire. Can I tell you something? Sure. Ma, I've been a nurse for 22 years. I've worked in 6 different hospitals, and I have never seen anyone do what you did today. Claire pulled on her street clothes, not looking up. You would have done the same. No, I wouldn't have. I would have panicked. I would have frozen. But you... Karen shook her head. You just stepped in and took control like it was the most natural thing in the world. It was necessary. That doesn't make it less impressive. Claire grabbed her bag, slinging it over her shoulder. I need to go. Claire, I need to go, she repeated, more firmly this time. Karen nodded, understanding. See you tomorrow? Yeah, tomorrow. Claire left through the back exit, avoiding the main hallway where people might stop her, might want to talk, might want to ask questions she didn't want to answer. The parking lot was nearly empty. The evening air was cool, carrying the smell of rain that hadn't fallen yet. She unlocked her car, a beat-up Honda Civic with a dent in the passenger door, and climbed in. For a long moment, she just sat there, hands on the steering wheel, staring at nothing. Then her phone buzzed, a text from an unknown number. This is Colonel Reeves. I know you said you'd think about consulting. The offer stands. We could use someone like you. Claire read it twice, then deleted it without responding. She started the car and drove home through quiet streets, past darkened storefronts and empty intersections. Her apartment was exactly as she'd left it. 1 bedroom, minimal furniture, nothing on the walls. She dropped her bag by the door, kicked off her shoes, and collapsed onto the couch. Her phone buzzed again. Another unknown number. This time, Captain Whitmore. This is Major Sarah Vance from Fort Brennan Command. We'd like to schedule a meeting regarding your involvement in today's incident. Please contact us at your earliest convenience. Claire stared at the message for a long time. Then she turned off her phone and closed her eyes. Tomorrow was going to be complicated. But tonight, she was just tired. Morning came too fast. Claire woke at 5:30 a.m. to her alarm, the same as always. She showered, dressed in clean scrubs, made coffee she didn't drink, and drove back to Redwood City Medical Center through streets still dark and empty. The hospital loomed ahead, its windows glowing yellow against the pre-dawn sky. She parked in the same spot she always used, grabbed her bag, and walked toward the employee entrance. Everything felt normal, routine. It wasn't. The moment she stepped through the doors, heads turned. A security guard she'd never spoken to nodded at her. A janitor paused mid-mop to watch her pass. 2 residents standing near the elevator went silent when they saw her, then started whispering the second she rounded the corner. Claire kept walking, eyes forward, face blank. The ER was already buzzing when she arrived. Tessa was at the nurses' station, talking animatedly to Karen and 2 other nurses Claire recognized but didn't know well. They stopped mid-conversation when they saw her. "Morning," Claire said, clipping her badge to her scrubs. "Morning," Tessa replied, too brightly. "How are you feeling?" "Fine." "Did you sleep okay?" "Fine." Karen leaned against the counter, studying her. "You get those messages from Fort Brennan?" Claire didn't answer, just pulled up the patient assignment board on the computer. 12 patients currently admitted. 3 in trauma bays. 2 waiting for transfer upstairs. Standard morning census. "Claire," Karen's voice was gentler now. "They're going to want to talk to you." "I know." "And the hospital administration. Dr. Voss left 3 voicemails for you last night." Claire's fingers paused on the keyboard. Dr. Leonard Voss was the chief medical officer, a man she'd seen exactly twice in 3 months, both times from a distance. "About what?" "About yesterday? About what happened? About—" Karen glanced at the other nurses, then lowered her voice. "About who you are." "I'm a nurse. You're a decorated combat medic who saved 6 lives during a mass casualty event. That's not nothing." Claire pulled up the first patient chart. "It's my job. It's more than that, and you know it." Before Claire could respond, Dr. Harmon appeared, looking like he hadn't slept. His tie was crooked, his hair uncombed, and there were dark circles under his eyes. "Claire, my office. Now." The other nurses exchanged glances. Claire logged out of the computer and followed him. Harmon's office was small, cluttered with medical journals and half-empty coffee cups. He closed the door behind them and gestured to a chair. Claire remained standing. "Sit," he said. "I'm fine." "Please." She sat. Harmon paced for a moment, hands running through his hair. Then he stopped and looked at her directly. "The hospital is conducting an internal review of yesterday's incident." "Okay. They want statements from everyone involved, patients, staff, the paramedics who brought in the casualties, and they want yours first." "When?" "Today, 9 a.m. Dr. Voss will be there, along with the hospital's legal team and a representative from Fort Brennan." Claire's expression didn't change. "What kind of review?" Standard protocol after a mass casualty event. They'll examine response times, resource allocation, decision-making processes. It's routine." "Doesn't sound routine." Harmon sat down heavily in his chair. "It's not really. Yesterday's event is all over the news. Armed convoy attacked in downtown Redwood. Multiple casualties, heroic emergency response. The hospital's getting calls from reporters, from city officials, from—" He stopped, rubbed his face. "They want to make sure everything was handled correctly, that we followed protocol." "Did we?" "You did. You handled it perfectly, but—" He hesitated. "But you also took charge in a way that bypassed normal chain of command. You gave orders to staff. You made clinical decisions without consulting me." Claire met his gaze steadily. "Would you have preferred I waited while people died?" "No, of course not. That's not what I'm saying." "Then what are you saying?" Harmon leaned back, exhaling slowly. "I'm saying the administration is going to ask questions. They're going to want to know why a nurse, regardless of her background, was making calls that typically fall under physician authority. And they're going to want to know why I didn't intervene. Because you were busy saving lives in Bay 1. I know that. You know that. But the people reviewing this weren't there. They're going to look at procedures, at hierarchy, at liability." He paused. "And they're going to look at you very closely." Claire stood. "Is there anything else?" "Claire, is there anything else, Dr. Harmon?" He looked at her, frustration and something like sadness crossing his face. "Just be prepared. This isn't going to be a pat on the back. They're going to dig. And when military brass gets involved, things get complicated. I'm aware." "Are you?" "Because from where I'm sitting, you seem remarkably calm for someone who's about to be put under a microscope." Claire's hand was on the door handle. "I've been under worse." She left before he could respond. The next 2 hours passed slowly. Claire moved through her rounds with the same quiet efficiency, checking vitals, administering medications, updating charts. But the atmosphere had shifted. Other staff members watched her differently now. Some with respect, some with curiosity, a few with something that looked uncomfortably like fear. At 8:45 a.m., a woman in a business suit appeared at the nurses' station. She was young, maybe 30, with sharp eyes and a leather portfolio tucked under one arm. "Claire Whitmore?" Claire looked up from the tablet she was reviewing. "Yes." "I'm Jessica Brennan, Hospital Legal Counsel. Dr. Voss is ready for you." "I still have patients. Coverage has been arranged. Please follow me." It wasn't a request. Claire set down the tablet and followed the woman through the hospital corridors, past the cafeteria, past the administrative wing, to a conference room on the third floor she'd never seen before. The room was large, dominated by a long table surrounded by leather chairs. 3 people were already seated. Dr. Leonard Voss sat at the head of the table, 60-something, silver hair, expensive suit. Next to him was a man in military dress uniform, his chest covered in ribbons. A nameplate on the table in front of him read, Colonel Marcus Hayes. The third person was a woman in her 40s wearing business casual, fingers flying across a laptop keyboard. Ms. Whitmore, Dr. Voss said, gesturing to an empty chair. Please, sit. Claire sat. Voss folded his hands on the table. Thank you for coming. I know this is sudden, but given the circumstances, we felt it important to convene quickly. Okay? Let me introduce everyone. You know Jessica Brennan from Legal. This is Colonel Hayes from Fort Brennan Command, and this is Sandra Mills, our HR director. He paused. We're here to discuss yesterday's incident and your role in the emergency response. Claire said nothing. Colonel Hayes leaned forward. Captain Whitmore. It's just Claire. I'm not active duty. My apologies, Claire. His voice was formal, but not unkind. I'm here representing Fort Brennan Command. We've been reviewing the events of yesterday, particularly your involvement in the medical response. We have some questions. I understand. Walk me through what happened, from the moment the first casualties arrived. Claire did. She spoke clearly, concisely, detailing every decision she'd made, every order she'd given, every patient she'd treated. She didn't embellish, didn't try to justify, just stated facts. When she finished, the room was silent for a long moment. Dr. Voss spoke first. You took charge of the trauma response. Someone had to. Dr. Harmon was the attending physician. Chain of command would dictate. Dr. Harmon was managing multiple critical patients simultaneously. I had experience with mass casualty situations. I acted accordingly. You gave orders to nursing staff. Yes. You made clinical decisions typically reserved for physicians. I made decisions that saved lives. Sandra Mills, the HR director, looked up from her laptop. Ms. Whitmore, hospital policy is very clear about scope of practice. Nurses, regardless of their background, are not authorized to what? To stop someone from dying? Claire's voice remained calm, but there was an edge to it now. Policy is designed for normal circumstances. Yesterday wasn't normal. That may be true, but Colonel Hayes held up a hand. Ms. Mills, if I may. He turned to Claire. Your military record is impressive. 3 deployments. Attached to Tier 1 Special Operations units. Over 200 confirmed saves under hostile fire. Multiple commendations. That was a different life. Was it? Because from what I'm hearing, you operated yesterday exactly the way you would have operated in a combat zone. Quick decisions, clear commands, immediate action. The principles are the same. Stop the bleeding. Secure the airway. Keep them alive. And you're very good at it. I do my job. Hayes studied her for a long moment. Why did you leave the military? The question hung in the air. Claire's jaw tightened almost imperceptibly. That's not relevant to yesterday's incident. I think it is. Because someone with your skills, your experience, your record, you could have stayed in, could have advanced, could have trained the next generation of combat medics. Instead, you're working the night shift in a civilian ER, making a fraction of what you could earn, dealing with, he glanced at a file in front of him, dealing with colleagues who don't know what you're capable of. I wanted something different. Different how? Claire met his gaze directly. I wanted to save people who got to stay saved. The words landed like a stone in still water. Hayes nodded slowly. I understand. Dr. Voss cleared his throat. Colonel, while Claire's background is certainly noteworthy, we need to address the procedural concerns. Hospital protocol exists for a reason. Patient safety, legal liability, professional standards. With respect, Dr. Voss, I was there. The voice came from the doorway. Everyone turned. Dr. Miles Harmon stood in the entrance, still looking rumpled but standing straighter than Claire had ever seen him. I was there, he repeated, stepping into the room. And I'm telling you, without Claire's intervention, we would have lost at least 3 of those patients, maybe more. Voss frowned. Dr. Harmon, this is a closed meeting. I'm the attending physician of record. I should have been here from the start. Harmon moved to the table but didn't sit. You want to talk about protocol? Fine. Protocol says the attending physician manages the trauma response, but protocol doesn't account for 6 critical patients arriving simultaneously with a 7th in full cardiac arrest. Protocol doesn't account for half our staff being out sick and the other half being first-year residents who'd never seen a GSW before. Dr. Harmon, I'm not finished. Harmon's voice was firm. Claire stepped in because I needed her to, because the situation required someone with combat trauma experience, and she was the only one in that room who had it. She didn't undermine my authority. She supported it. She made my job possible. Sandra Mills typed rapidly on her laptop. That's your professional assessment? That's my sworn statement. Voss exchanged a glance with Jessica Brennan, who gave a small nod. Very well, Dr. Harmon, you'll need to submit that in writing. Already done. Send it to your office an hour ago. Colonel Hayes smiled faintly. Sounds like you've got a strong team, Dr. Voss. Voss didn't look convinced. The issue remains that hospital policy was bypassed. Regardless of outcome, we have procedures in place that must be followed. Even when following them would cost lives? Claire's voice was quiet but cutting. That's not what I'm saying. Then what are you saying? Voss straightened in his chair. I'm saying that this hospital has to protect itself. Legally, professionally, financially. What happened yesterday was extraordinary, but it also exposed significant gaps in our emergency preparedness. Gaps that could lead to liability if not addressed properly. So this is about covering the hospital's ass. Jessica Brennan leaned forward. Ms. Whitmore, I'd advise you to... I'm just trying to understand. Claire's eyes moved from Voss to Brennan to Mills. 6 people are alive today because of what happened yesterday. But instead of asking how we can be better prepared next time, we're sitting here debating whether I followed the right forms. It's more complicated than that, Voss said. Is it? The room went quiet. Colonel Hayes broke the silence. Dr. Voss, what exactly is the hospital's concern here? Because from where I sit, you've got a staff member who performed exceptionally under pressure. That seems like something to celebrate, not investigate. Voss shifted uncomfortably. Colonel, I appreciate your perspective, but you're not responsible for the operational integrity of this facility. If questions arise about our protocols, about our supervision of nursing staff, about whether you can be sued, Hayes finished, I get it, but let me be clear about something. Fort Brennan Command has reviewed the incident. We've interviewed witnesses, examined the timeline, consulted with our own medical personnel, and our conclusion is unequivocal. Claire Whitmore's actions were not only appropriate but exemplary. Any attempt to discipline or discredit her will be met with full opposition from the military. Dr. Voss's eyes narrowed. Are you threatening this hospital? I'm stating facts. The convoy that was attacked yesterday? It was transporting classified military assets. The casualties included active duty personnel. This isn't just a civilian matter anymore. It's military jurisdiction, and we take care of our own. Claire is no longer military. She'll always be military. Hayes stood. This meeting is over. Unless you plan to charge Ms. Whitmore with misconduct, she's free to go. Voss looked at Jessica Brennan, who gave a small, helpless shrug. Fine, Voss said tightly. Ms. Whitmore, you're dismissed, but understand that this review is ongoing. We'll be examining procedures, conducting additional interviews. This isn't finished. Claire stood. Am I suspended? No. Then I have patients to check on. She walked out without waiting for a response. Harmon caught up with her in the hallway. Claire, wait. She stopped but didn't turn around. Thank you, he said. For yesterday. For doing what I couldn't. You did fine. I froze. For about 10 seconds when those gurneys came through, I completely froze. And if you hadn't been there, someone else would have stepped up. No, they wouldn't have. Harmon moved around to face her. I've been a doctor for 15 years. I've worked in 3 different hospitals. And I've never seen anyone do what you did. Not doctors, not nurses, not anyone. You're giving me too much credit. I'm giving you exactly the credit you deserve. And I told them that in my statement. Claire's expression softened slightly. I appreciate that. I should have said something yesterday. When Cole was harassing you, I should have shut it down immediately. It's done. It's not done, because now the whole hospital knows who you are, and that's going to change things. It doesn't have to. It already has. Harmon gestured down the hallway where several staff members were clearly watching them, pretending not to. You're not invisible anymore. Claire looked at the onlookers, then back at Harmon. I never wanted to be visible. I know, but that's not your choice anymore. She started to respond, but her pager buzzed. She glanced at it, frowned. What is it? Harmon asked. Code blue. ICU. They both ran. The ICU was on the 4th floor, accessed through a set of heavy double doors that required badge access. Claire and Harmon burst through just as alarms started blaring. Nurses were rushing toward room 412, where yesterday's cardiac arrest patient, The one Claire had brought back was crashing again. Claire didn't slow down. She pushed through the growing crowd of staff, saw the monitor showing ventricular fibrillation, saw the ICU attending, a woman named Dr. Patricia Ramos, already calling for the crash cart. What happened? Claire demanded. Ramos didn't question her presence. Sudden rhythm change. He was stable an hour ago. Then his pressure started dropping and move. Claire was already at the bedside, hands moving to check the patient's airway, his chest, his IV lines. He's got a pneumothorax. Left side. I can see the tracheal deviation. How can you... Chest tube. Now. We don't have time for an x-ray. Ramos hesitated for half a second, then grabbed the kit a nurse was already holding out. You're sure? Positive. They worked together, Ramos prepping the site while Claire maintained the airway. The procedure took less than 3 minutes. The moment the tube was placed and the seal secured, the monitor started to stabilize. The frantic beeping slowed, regulated. The patient's oxygen levels climbed. Ramos stepped back, breathing hard. How did you know? Experience. You just looked at him and knew. I've seen it before. Ramos wiped sweat from her forehead. In the military? Claire didn't answer. She was already checking the chest tube placement, adjusting the suction, making sure everything was secure. Around them, the ICU staff watched in silence. Then one of the nurses, an older man named David, spoke up. You saved him twice. Claire glanced over. Team effort. Yesterday you brought him back from dead. Today you caught a pneumo before it killed him. That's not team effort, that's you. I was in the right place at the right time. Twice, David repeated. What are the odds? Before Claire could respond, her phone vibrated. She pulled it out, saw another message from an unknown number. Captain Whitmore, this is Major Vance again. We need to speak with you urgently. Please call at your earliest convenience. This is not optional. She deleted it. Dr. Ramos approached, lowering her voice. Can we talk? Privately? Claire followed her to a small consultation room off the main ICU floor. Ramos closed the door and turned to face her. I heard what happened yesterday, Ramos said. The whole hospital's talking about it. I'm aware. They're also talking about the meeting this morning, about how Voss tried to come after you and the military shut him down. News travels fast. Ramos crossed her arms. Look, I don't know you. We've never worked together before today, but I've been in ICU attending for 8 years, and I know talent when I see it. What you did just now, that wasn't luck. That was skill. What's your point? My point is that you're wasted in the ER. You should be up here in critical care or in trauma surgery. Somewhere your experience actually matters. I like where I am. Do you? Because from where I'm standing, it looks like you're hiding. Claire's jaw tightened. Excuse me? You're hiding, Ramos repeated, but her tone wasn't accusatory, just matter of fact. You've got skills most physicians would kill for, and you're using them to check blood pressure and start IVs. That's hiding. Or maybe I just want a quiet life. Then you picked the wrong career. Medicine isn't quiet, especially not for someone like you. Someone like me. Someone who can't stand by and watch people die when they know they can save them. Ramos moved closer. I saw your face when you came in here. You didn't even hesitate. You saw the problem and you fixed it. That's not hiding. That's instinct. And you can't turn that off any more than you can turn off breathing. Claire looked away. I'm done with this conversation. Fair enough? But think about what I said. Ramos opened the door. You've got a gift. Seems like a waste to bury it. Claire left without responding. The rest of her shift blurred together. She moved from patient to patient, task to task, but her mind was elsewhere. Pieces of conversations kept echoing. Harmon's voice. You're not invisible anymore. Ramos. That's hiding. Colonel Hayes. You'll always be military. By the time 6 p.m. rolled around, Claire was exhausted in a way that had nothing to do with physical work. She was gathering her things from her locker when Tessa appeared. Hey, you okay? Fine. You don't look fine. Claire pulled on her jacket. Long day. I heard about the ICU thing, about how you saved that guy again. Tessa leaned against the locker next to Claire's. People are saying you're like, I don't know, some kind of medical superhero or something. People say a lot of things. Are they wrong? Claire slammed her locker shut, harder than she intended. I'm just a nurse, Tessa. That's all. But you're not, though. Not really. I mean, you are, but you're also... I'm going home. Claire, I'll see you tomorrow. She left before Tessa could say anything else. The parking lot was dark, illuminated by scattered lights that cast long shadows across the pavement. Claire's car was parked in the far corner, away from the main entrance. She was halfway there when she saw him. Lieutenant Ethan Cole stood next to her car, still in uniform, hands clasped behind his back. Claire stopped. "What are you doing here?" "Waiting for you." "Why?" Cole shifted his weight, uncomfortable. "I needed to apologize. Again. Properly this time." "You already apologized." "I apologized for being an ass. I didn't apologize for what I cost you." Claire frowned. "What are you talking about?" "The review, the meeting this morning. That happened because I made a scene. Because I disrespected you in front of witnesses, and it got back to administration." He looked down. "If I'd just kept my mouth shut, none of this would have happened. You don't know that. I know that I made things harder for you, and I'm sorry." Claire studied him for a long moment. He looked different than yesterday. Smaller, less certain. The arrogance had been stripped away, leaving something raw underneath. "Apology accepted," she said finally. "Now move. I want to go home. There's something else." "Of course there is." Cole reached into his jacket and pulled out an envelope. "This came through official channels today, from Fort Brennan Command." Claire didn't take it. "What is it?" "A formal commendation for your actions yesterday. They're putting it in your permanent record." "I don't have a permanent record anymore. I'm not active duty." "They're reinstating it retroactively, and they're offering you a consulting position. 6-month contract, renewable. Training combat medics in mass casualty response." Claire stared at the envelope like it was a live grenade. "I'm not interested." "They thought you'd say that. That's why they also included a signing bonus, $50,000. The number hung in the air between them. "I don't want it," Claire said quietly. "Why not? You'd be perfect for it. You could save lives, train the next generation, make a real—" "I said I don't want it." Cole's expression shifted, something like understanding crossing his face. "You really meant it, didn't you? When you said you wanted to save people who got to stay saved." Claire's hand was on her car door. "Good night, Lieutenant." "Wait." He held out the envelope again. "At least take this. Even if you don't want the job, the commendation is yours. You earned it." She didn't take it. Cole set it on her windshield. "I'll leave it here, in case you change your mind." He walked away, boots echoing across the parking lot. Claire stood alone in the dark, staring at the envelope. White, official, sealed with the Department of Defense emblem. Inside was recognition, validation, a return to the life she'd left behind. She picked it up. For a long moment, she just held it, feeling the weight of it, the implications of it. Then she tore it in half, and then in half again, and again. The pieces fluttered to the ground like snow. Claire got in her car and drove home through empty streets, past closed shops and darkened windows. Her apartment was exactly as she'd left it that morning. She dropped her bag, kicked off her shoes, and collapsed onto the couch. Her phone buzzed. Another message. "Miss Whitmore, this is Jessica Brennan from Hospital Legal. Please contact me immediately. There's been a development." Claire deleted it without reading it twice. Another message, this time from Karen. "Turn on the news, Channel 7, now." Claire grabbed the remote and turned on the TV. The local news was on, showing footage of yesterday's convoy attack. Then the scene cut to a press conference. Dr. Leonard Voss stood at a podium, flanked by hospital administrators and city officials. "Extraordinary circumstances require extraordinary measures," Voss was saying, which is why Redwood City Medical Center is proud to announce the formation of a new elite trauma response team, designed to handle mass casualty events with military precision and efficiency. Claire's stomach dropped. "Leading this initiative will be one of our own staff members," Voss continued. "A decorated combat veteran with extensive experience in trauma medicine. Someone who has already proven their capabilities in the most challenging circumstances imaginable. No. Please join me in welcoming the director of our new critical response unit, Captain Claire Whitmore." The screen filled with Claire's face, her hospital ID photo, blown up to fill the frame. Claire stared at the TV, frozen. Her phone exploded with notifications. Messages from Tessa, Karen, Harmon, numbers she didn't recognize. The news feed scrolled below Voss's image. Local nurse revealed as decorated combat hero. Hospital announces new trauma program. Military veteran to lead emergency response team. Claire's hands were shaking. She hadn't agreed to any of this. Hadn't been consulted. Hadn't even been told. They'd just decided. Announced it to the world. Put her face on television and committed her to a role she never wanted. Her phone rang. Unknown number. She answered without thinking. "What?" "Captain Whitmore, this is Major Sarah Vance from Fort Brennan Command." The voice was crisp, professional. I assume you've seen the news. I didn't agree to this. I'm aware. Unfortunately, hospital administration moved forward without proper coordination. We're working to address the situation. Address it how? That depends on you. You have options. You can refuse the position, of course, but the announcement has already been made public. Refusing now would create significant complications for both you and the hospital. I don't care about complications. I think you do, because if you refuse, the hospital will have to issue a retraction. They'll have to explain why their announced program director declined the role. Questions will be asked. Your background will be scrutinized. The media will dig. Claire closed her eyes. What are you saying? I'm saying that, like it or not, you're in the spotlight now, and you have two choices: control the narrative or let it control you. There's a third choice. I quit. You could. But then what? Move to another city? Change your name? Hope no one recognizes you? Vance's voice softened slightly. Claire, I've read your file, all of it. I know why you left. I know what you're running from. But running doesn't work forever. Eventually, you have to stand still and deal with what's chasing you. You don't know anything about me. I know you saved 214 lives over 3 deployments. I know you were recommended for the Medal of Honor twice and turned it down both times. I know you watched 17 people die under your hands because the wounds were too severe, the damage too extensive, and you blamed yourself for every single one. I know you left because you couldn't save one more soldier just to watch them ship back out and maybe die the next week. And I know, Vance paused. I know that you came here thinking you could save people quietly, anonymously, without anyone knowing what you're capable of. But that's over now. Claire's throat was tight. What do you want from me? I want you to make a choice, a real one, not a reaction, not an escape, a choice. What are my options? Option 1, accept the hospital's position. Lead the trauma team. Use your skills to save lives here, where people get to go home after. Option 2, come back to Fort Brennan. Take the consulting position. Train the next generation so they can save lives the way you did. Option 3, walk away from all of it. Quit, move, start over. Again. Claire's hand tightened on the phone. When do I have to decide? The hospital's press conference was an hour ago. By morning, every news outlet in the state will be running the story. You have until then to make a statement. After that, the decision makes itself. The line went dead. Claire sat in the dark, TV still playing, her face still on the screen. The remote was in her hand, but she couldn't bring herself to turn it off. Someone knocked on her door. She didn't move. The knock came again, harder this time. Claire, it's me. Open up. Tessa's voice. Claire stood slowly, walked to the door, opened it. Tessa stood in the hallway, still in her scrubs, eyes red. Did you see it? Yeah. Did you know they were going to— No. Tessa stepped inside without being invited. This is insane. They can't just announce something like that without asking you first. Apparently they can. So what are you going to do? Claire closed the door, leaned against it. I don't know. You could sue them for using your name without permission, for— That won't fix anything. Then what will? Claire didn't answer. Tessa moved closer, her voice dropping. You're going to leave, aren't you? You're going to quit and disappear, and we'll never see you again. I don't know. Yes, you do. I can see it in your face. You're already halfway gone. Tessa, just tell me one thing. Yesterday, when everything went to hell and you stepped in and saved all those people, did you feel like you were doing the right thing? Claire met her eyes. Yes. Then why does it matter if people know? Why does it matter if you get recognized for it? Because I didn't do it for recognition. I did it because it needed to be done. And now it needs to be done again. On a bigger scale. With better resources. With people who actually know what they're doing. Tessa's voice was fierce. Claire, I've been a nurse for 4 years. I'm good at my job. But I'm not you. None of us are. And if you leave, people are going to die who didn't have to. That's not fair. It's completely fair. You have a gift. You can't just bury it because you're uncomfortable with attention. It's not about attention. Then what is it about? The question hung between them. Claire's voice was barely above a whisper. It's about not going back to being that person. The one who has to make life and death decisions every single day. The one who carries the weight of everyone who didn't make it. I left that behind for a reason. Did you? Or did you just trade one set of dying people for another? Claire flinched. Tessa's expression softened. I'm sorry, that was harsh. But Claire, you can't save everyone. Not in war zones, not here, not anywhere. All you can do is show up and do your best. And your best happens to be better than almost anyone else's. That's not a curse. It's a responsibility. Before Claire could respond, her phone rang again. Different number this time. She answered. What? Miss Whitmore, this is Channel 7 News. We'd like to schedule an interview regarding your... Claire hung up. Immediately, another call. This is Tribune Press. We're running a story on... She hung up again. Her phone started buzzing nonstop. Calls, texts, voicemails piling up faster than she could delete them. Tessa watched, her face grim. It's going to be like this now. You know that, right? No matter what you choose. Claire turned off her phone and set it on the counter. They stood in silence for a long moment. Finally, Tessa spoke. Whatever you decide, I've got your back. Just don't decide tonight. Sleep on it. Give yourself time to think. Time won't change anything. Maybe not, but you deserve it anyway. Tessa left. Claire locked the door behind her and returned to the couch. The TV was still on, still showing her face, still narrating a story she hadn't written. She picked up the remote, turned it off, sat in the dark. At 11:47 p.m., someone started pounding on her door. Not knocking, pounding. Hard enough to shake the frame. Claire jumped up, heart racing. Through the peephole, she saw two figures in dark suits, federal agents maybe. Or worse. Miss Whitmore, open the door. We need to speak with you immediately. She didn't recognize the voice. This is a matter of national security. Open the door now, or we will be forced to... Claire yanked the door open. What? The two men stood in the hallway, both wearing FBI badges on their belts. The taller one spoke first. Claire Whitmore? Yes. We need you to come with us. Why? Yesterday's convoy attack. We have new information. Information that directly involves you. Claire's blood went cold. What kind of information? The second agent stepped forward. The attack wasn't random. It was targeted. And according to our intelligence... He paused, choosing his words carefully. According to our intelligence, you were the target. Claire's hand stayed on the doorframe, knuckles white. What do you mean I was the target? The taller agent, his badge read Special Agent Marcus Dillon, gestured toward the hallway. Not here. We need to move you to a secure location. Now. I'm not going anywhere until you explain what's happening. The second agent, too younger with a scar running along his jaw, stepped closer. His badge said Special Agent Ryan Kozak. Ms. Whitmore, we have credible intelligence that yesterday's attack was planned specifically to draw you out. Someone knew you worked at Redwood City Medical. They knew a mass casualty event would force you to respond, and they knew it would expose you. Claire's mind raced. That doesn't make sense. I'm nobody. I've been out of the military for 2 years. Why would anyone... Because of Operation Sandstorm, Dillon said quietly. The name hit her like a punch to the chest. She hadn't heard it spoken aloud in over 3 years. Operation Sandstorm. A classified mission, her last deployment. The one that ended with bodies she couldn't save and orders she couldn't follow, and a discharge that looked voluntary on paper but felt like survival. That's classified, Claire said, her voice tight. It was classified. Until 6 months ago, when someone leaked operational details to a foreign intelligence network. Names, dates, locations. Everyone involved in Sandstorm is now a potential target. Dillon pulled out a tablet, showed her a grainy photograph. Recognize him? Claire looked at the image. A man in his 40s, Middle Eastern features, wearing civilian clothes but standing like military. Something about the eyes was familiar, but she couldn't place it. No. His name is Rashid Khalil, former intelligence officer, now working freelance for the highest bidder. 3 weeks ago, he entered the country on a forged passport. 2 weeks ago, he was spotted in Redwood City. Yesterday, he orchestrated the convoy attack. How do you know this? Kozak spoke up. Because we've been tracking him since he landed. We knew he was planning something, but we didn't know the target until yesterday when our surveillance caught him watching the hospital. Watching you. Claire's stomach twisted. Why didn't you warn me? We didn't know you were here. Your discharge paperwork listed you as relocated to Oregon. We had no idea you were working at Redwood City Medical until the news coverage started. By then, it was too late. Dillon put the tablet away. We need to move you. Khalil is still in the city. He's not done. What does he want? Revenge. During Operation Sandstorm, you saved the life of a high-value intelligence asset. That asset provided information that led to the dismantling of Khalil's entire network. He lost everything. His position, his reputation, his income. And he blames you. Claire's hands were shaking now. She remembered the operation, the asset. A translator who'd taken 3 rounds to the chest during an ambush. She'd kept him alive for 47 minutes until the extraction team arrived. She'd never learned his name, Never knew what information he'd provided, never thought about him again after the debriefing. But someone had. Someone had remembered. I need to make a call, Claire said. No calls. No contact with anyone outside of federal protection. It's not safe. I work at a hospital. People depend on me. I can't just disappear without. You can and you will, Dylan said firmly. Pack a bag. Essentials only. We leave in 5 minutes. And if I refuse, then Khalil will kill you, and probably anyone standing near you when he does it. Your choice. Claire looked between them, searching for deception, for exaggeration. She found only certainty. She grabbed her bag. 4 minutes later, she was in the back of an unmarked SUV, flanked by Dylan and Kozak, racing through empty streets toward an undisclosed location. The city blurred past. Familiar buildings turned strange in the darkness. Every shadow suddenly a potential threat. Where are we going? Claire asked. Safe house. Federal facility. You'll stay there until we can neutralize the threat. How long? As long as it takes. They drove for 20 minutes, leaving the city behind, heading into industrial areas where streetlights became sparse and buildings gave way to warehouses. The SUV turned down a service road, passed through a checkpoint guarded by armed personnel, and pulled into an underground garage. The safe house was a converted office building, 3 stories, reinforced windows, multiple security stations. Dylan led Claire through a series of corridors to a small room on the 2nd floor. It had a bed, a desk, a bathroom. No windows. Stay here. Don't leave without an escort. Don't contact anyone outside. Someone will bring you food and water. For how long? I told you, as long as it takes. Dylan left. The door locked behind him with a heavy click. Claire sat on the bed and tried to process what was happening. Operation Sandstorm. Rashid Khalil. A man she'd never met wanted her dead because she'd done her job and saved a life. The absurdity of it would have been laughable if it wasn't so terrifying. Hours passed. No one came. Claire tried the door twice. Locked. She paced the room, examined every corner, looked for anything useful. Nothing. Just gray walls and fluorescent lights and the distant hum of ventilation. At 3:17 a.m., someone knocked. Claire stood. Yeah? The door opened. A woman in a business suit stepped in, carrying a manila folder. She was 50s, sharp eyes, hair pulled back in a tight bun. Ms. Whitmore, I'm Deputy Director Elena Vasquez, FBI Counterterrorism Division. We need to talk. Claire remained standing. About what? About how we're going to use you as bait. The words hung in the air like smoke. Claire's jaw tightened. Excuse me? Vasquez closed the door and sat at the desk, gesturing for Claire to sit on the bed. Claire didn't move. Rashid Khalil wants you dead, Vasquez said, opening the folder. He's patient, well-funded, and highly motivated. He'll keep trying until he succeeds or until we stop him. Right now, he doesn't know where you are, but that won't last. He has resources, contacts. Eventually, he'll find you. So you want to give me to him? We want to control the circumstances, set a trap, draw him out on our terms, in a location we control, with assets in place to neutralize him before he can strike. And if something goes wrong, that's why we're having this conversation. This is voluntary. We can't compel you to participate. But if you don't, we can only offer passive protection, hiding you indefinitely, changing your identity, relocating you somewhere remote, and hoping he never finds you. That doesn't sound like much of a choice. It's not. Vasquez leaned forward. But there's a third option. You help us catch him, you put him down permanently, and you get your life back. Claire finally sat, her mind calculating risks, assessing angles. What's the plan? Tomorrow morning, the hospital holds a press conference. You appear publicly, accept the position they announced. Make yourself visible. Make yourself accessible. Khalil will see it. He'll plan his move. And when he does, we'll be ready. You're using the hospital as the kill zone. We're using a controlled environment with civilian presence to force Khalil into a predictable pattern. He won't attack in broad daylight with witnesses. He'll wait until you're isolated, moving between locations. That's when we intercept. And if he doesn't follow your script, then we adapt. But our psychological profile suggests he will. He's meticulous, patient. He won't rush. Claire stood, paced to the far wall, turned back. What about the people at the hospital? Tessa, Karen, Dr. Harmon. If Khalil comes after me there, we'll have agents embedded throughout the facility. Security will be increased. No one will know it's happening, but every exit, every stairwell, every parking lot will be monitored. The moment Khalil makes a move, we take him down. You can't guarantee their safety. No, I can't, but I can guarantee that if we don't stop Khalil now, he'll keep coming. And the next time we might not see him coming. The next time he might take out a room full of people just to make sure he gets you. Claire's hands clenched at her sides. How many agents? 12 embedded inside the hospital. Another 20 in support positions outside. Sniper overwatch on adjacent buildings. Tactical response team on standby. We're not taking chances. When? Press conference is scheduled for 10 a.m. You'll be transported under armed escort. You'll read a prepared statement, take no questions, and return here immediately. The exposure window is less than 30 minutes. Claire walked to the door, tested the handle. Still locked. And if I say no, then you disappear. New name, new city, new life. And you spend the rest of your days looking over your shoulder, wondering if today's the day he finds you. The choice wasn't really a choice at all. I'll do it, Claire said. Vasquez stood, closed the folder. Get some sleep. Tomorrow's going to be a long day. She left. Claire didn't sleep. She sat on the bed, staring at the wall, running through scenarios. Khalil was a professional. If the FBI's profile was accurate, he wouldn't be predictable. He'd see the press conference for what it was, a trap, and he'd find another way. At 6 a.m., someone brought her breakfast. Toast, eggs, coffee. Claire ate mechanically, tasting nothing. At 8 a.m., Dylan appeared with clothing. Business casual, we need you to look professional. Claire changed. Black slacks, white blouse, blazer. She looked at herself in the small bathroom mirror. The woman staring back looked tired, haunted, nothing like the calm, controlled medic she'd been 2 days ago. At 9:15 a.m., the convoy assembled. 3 SUVs, all armored, all driven by agents in tactical gear. Claire was placed in the center vehicle, sandwiched between Dylan and Kozak. Stay low, Dylan said. Windows are bulletproof, but no reason to take chances. They drove through morning traffic, sirens clearing the way. Claire watched the city pass, trying to spot anything unusual, trying to think like Khalil would think. Where would she position herself if she wanted to take out a convoy? What angles would she use? What contingencies would she plan? The hospital came into view. News vans lined the street. Cameras were already set up. A crowd had gathered. Reporters, hospital staff, curious onlookers. The convoy pulled into a secured loading area. Agents formed a perimeter. Claire was escorted out, surrounded on all sides, moved quickly through a service entrance and up to the administrative conference room where the press conference would be held. Dr. Voss was already there, looking nervous. Miss Whitmore, thank you for coming. I know this is sudden, but let's just get this over with, Claire said. Voss nodded, relieved. Of course. We'll go out together. I'll introduce you, you'll read your statement, and then we'll exit. Simple. Nothing about this was simple. At 9:58 a.m., they walked onto the small stage set up in the conference room. Cameras flashed. Reporters shouted questions. Voss stepped to the podium, raised his hands for quiet. Thank you all for coming. As you know, Redwood City Medical Center experienced an unprecedented emergency situation 2 days ago. Thanks to the extraordinary efforts of our staff, particularly one individual, all casualties were successfully treated and are currently in stable condition. Claire stood beside him, scanning the room. Agents were positioned along the walls, dressed as hospital security. She spotted Kozak near the back exit, Dylan by the windows. Others she didn't recognize but could identify by their posture, their positioning, their eyes constantly moving. It is my honor, Voss continued, to introduce the person who will be leading our new critical response unit, a decorated combat veteran whose skills and experience make her uniquely qualified for this role. Captain Claire Whitmore. Applause. Camera flashes. Claire stepped to the microphone. The prepared statement was in her hand. 2 paragraphs. Generic. Safe. She looked at it. Then she looked at the cameras. And she went off script. 2 days ago, people died in this city. An armed convoy was attacked. Casualties flooded our emergency room. And I did what I was trained to do. I tried to save them. Not because I wanted recognition, not because I wanted a promotion or a new position, because that's the job. Voss shifted uncomfortably beside her. Claire continued. I left the military because I was tired of saving people just to send them back into danger. I came here thinking I could do the same work quietly, anonymously. But that's over now. My name is out there. My face is on television, and someone wants me dead because of a life I saved 3 years ago. The room went silent. Even the reporters stopped shouting. So here's what I want to say. To whoever's watching. To Rashid Khalil, if you're listening. Claire leaned into the microphone. I'm not hiding. I'm not running. You want to come after me? I'm right here. But know this. I've saved over 200 lives under fire. I've worked in conditions you can't imagine, with equipment that barely functioned, surrounded by people trying to kill me. And I did my job anyway. You think you can intimidate me? You think you can make me afraid? I've been afraid before. It didn't stop me then. It won't stop me now. Dylan was moving toward the stage, urgency in his movements. Claire stepped back from the microphone. That's all I have to say. Chaos erupted. Reporters surged forward. Voss grabbed her arm. What the hell was that? That wasn't the statement we... Get her out, Dylan barked. Now. Agents surrounded Claire, moving her toward the exit. Questions followed them into the hallway. Ms. Whitmore, who is Rashid Khalil? Are you saying the attack was targeted? Is the hospital in danger? The service door slammed shut behind them. Dylan spun to face Claire. What the hell were you thinking? I was thinking that your plan was garbage. Khalil isn't an idiot. He'd see through the press conference, so I gave him what he wanted, a direct challenge. Now he has to respond. You just painted a target on your back? The target was already there. Now at least we control the message. Kozak appeared, phone to his ear. He listened for a moment, then lowered it. We've got movement. Cameras outside just spotted a vehicle matching the description of Khalil's last known transport. 2 blocks west, heading this direction. Dylan's face went hard. Get her to the safe room. Lock it down. They moved fast, Claire surrounded by agents, heading deeper into the hospital. But as they passed the ER entrance, Claire heard something that made her stop. Screaming. Not panic, not fear. Pain. She pulled away from the agents, pushed through the double doors into the ER. Chaos. 3 patients on gurneys, all bleeding heavily. Tessa was at the nurse's station, phone pressed to her ear, face white. Karen was trying to start an IV on a patient who kept thrashing. Dr. Harmon was nowhere to be seen. What happened? Claire demanded. Tessa looked up, relief and terror mixing on her face. Car accident. Multi-vehicle pileup on the freeway. We've got 7 incoming, at least 4 critical. Where's Harmon? Stuck in traffic. He can't get here for another 20 minutes. Claire looked at the patients, looked at the staff struggling to keep up, looked at Dylan, who was already shaking his head. No, he said. Absolutely not. We need to get you out of here. These people are dying. And you'll die too if you stay. Khalil could be in this building right now. Claire met his eyes. Then your agents better do their job, because I'm doing mine. She didn't wait for permission. She grabbed a pair of gloves from the dispenser, snapped them on, and moved to the nearest patient, a woman in her 30s, conscious but bleeding from a head wound. Tessa, get me a trauma kit. Karen, stop what you're doing and help me stabilize this one first. We triage, we treat, we move fast. Dylan grabbed her arm. Claire, you've got agents all over this building. Use them. Secure the ER. Lock down the entrances. But I'm not leaving these people to die because some asshole wants revenge. Dylan stared at her for 3 seconds. Then he spoke into his radio. All units, converge on ER. Establish perimeter. No one in or out without clearance. And find me Rashid Khalil before he finds us. He turned to Claire. You've got 10 minutes. Then we pull you out whether you're done or not. Claire was already working. The next 8 minutes were a blur of controlled chaos. Claire moved between patients, assessing, directing, treating. A compound fracture here, internal bleeding there, a tension pneumothorax that needed immediate decompression. Tessa and Karen followed her lead, their hands steadier with Claire's voice guiding them. But in the back of her mind, a clock was ticking. Khalil was coming. At the 7-minute mark, Kozak appeared at her elbow. We've lost visual on the vehicle. It entered the parking structure and disappeared. Claire didn't look up from the IV line she was placing. How many exits? 4. All covered. But if he's already inside, then find him. At the 9-minute mark, Dr. Harmon burst through the doors, out of breath. I'm here. What do you need? Claire stepped back from the patient she'd just stabilized. Bay 3 needs a chest tube. Bay 1 needs surgical consult for possible spleen rupture. Bay 2 is stable but needs monitoring. Where are you going? To finish this. Dylan was waiting. Time's up. We're moving you now. They exited through the service corridor, agents front and back, weapons drawn. The hospital felt different now, quieter, emptier, like everyone had sensed the danger and disappeared. Emergency lighting cast strange shadows. Somewhere, an alarm was beeping. Elevator or stairs? Kozak asked. Stairs, Dylan said. 2 exposed in the elevator. They entered the stairwell. Their footsteps echoed. Claire was in the center of the group, surrounded, protected, but something felt wrong. The agents were too tense, too reactive. They were expecting an attack, which meant they didn't know where Khalil was. At the 2nd floor landing, Dylan's radio crackled. We've got a problem. Security footage just went dark. Someone cut the feeds. When? 90 seconds ago. Dylan swore. He's already inside. Change of plan. We get to the garage. We get her in a vehicle. We get her out. They descended faster now, taking stairs two at a time, one floor, then another. The garage level was just ahead. The door exploded inward. Not an actual explosion, just the force of it slamming open, the metal shrieking. A figure appeared in the doorway, backlit by garage lights, moving with the fluid precision of someone who'd done this before. Rashid Khalil. He had a gun. Time fractured. Dylan shoved Claire backward. Kozak raised his weapon. Other agents moved to create a human shield. Khalil fired. The sound was deafening in the enclosed space. An agent to Claire's left went down, blood spraying. Another returned fire. Bullets punched through drywall, shattered the overhead light. Darkness. Muzzle flashes provided the only illumination, strobing, disorienting. Claire hit the ground, rolled to cover behind the concrete landing. Her training kicked in. Assess, adapt, act. Khalil wasn't alone. More figures poured through the doorway. At least 3, maybe 4. They moved like professionals, covering angles, suppressing fire, advancing in coordinated movements. This wasn't a revenge killing. This was an execution. Dylan was shouting into his radio, "Officer down! We need backup in the north stairwell!" A bullet caught him in the shoulder. He spun, went down hard. Claire didn't think. She moved. She grabbed Dylan's weapon from his holster, muscle memory from a life she'd left behind, and fired 3 controlled shots at the advancing figures. One went down. The others dove for cover. Kozak was bleeding from a leg wound, but still fighting. "Get out! Go! Not without you. Go!" Claire ran. Up the stairs, not down. Away from the garage. Away from Khalil's team. She could hear boots pounding behind her, orders being shouted in a language she didn't speak but recognized. Arabic. Khalil's people. She burst through the 3rd-floor door, found herself in a hospital corridor. Empty. Lights flickering. She ran, lungs burning, Dylan's gun heavy in her hand. A door ahead. The radiology department. She hit it at full speed, locked it behind her. The room was dark, filled with expensive equipment. MRI machines, CT scanners, control stations with blank screens. Claire moved deeper, found a closet containing lead aprons and positioning cushions. She pulled the door almost closed, leaving a crack to see through. Footsteps in the hallway. The radiology door rattled, then a gunshot. The lock shattered. 2 men entered. One was Khalil. She recognized him from the photograph. The other was younger, heavier, carrying an automatic rifle. They spoke quietly in Arabic. Claire's grasp of the language was limited, but she caught enough. Searching. Sweep. Find her. They split up. The younger one moved toward the MRI suite. Khalil headed toward the closet. Claire's hand tightened on the gun. She had maybe 6 rounds left, maybe fewer. She hadn't counted in the stairwell. Khalil stopped 3 feet from the closet. He was listening, head tilted. Claire held her breath. Then her phone buzzed in her pocket. The sound was soft, muffled, but in the silence, it was a gunshot. Khalil's eyes snapped to the closet. Claire exploded outward. She didn't give him time to react. She hit him low, drove him backward into a control console. His gun clattered away. They went down together, grappling, twisting. Khalil was strong, trained. He got an arm around her throat, started to squeeze. Claire drove her elbow back into his ribs. Once. Twice. His grip loosened. She twisted free, scrambled for his gun. The younger man appeared in the doorway, rifle raised. Claire grabbed Khalil, used him as a shield. "Tell him to drop it," she said, pressing Dylan's gun to Khalil's temple. Khalil's voice was steady despite the circumstances. "You won't shoot. You're a medic. You save lives, not take them. Try me. You saved the translator, Bashar Hadid. He gave your government information that destroyed everything I built, everything I was. Because of you. I did my job. Your job cost me everything. So you kill innocent people? You attack a convoy? You put a hospital at risk? For what? Revenge won't bring back what you lost. No, but it will make you understand what loss feels like." The younger man still had his rifle trained on them. Claire's mind raced. She couldn't shoot them both. Even if she dropped Khalil, the other one would kill her. But if she let Khalil go, the door burst open behind the younger man. Federal agents flooded in, tactical gear, automatic weapons, laser sights, painting red dots across every surface. The younger man spun, raised his rifle. "Drop it!" an agent shouted. Everything happened at once. The younger man fired. The agents returned fire. Claire hit the ground, dragging Khalil with her. Bullets tore through equipment, shattered monitors, punctured the walls. Then silence. The younger man was down, bleeding out on the floor. Claire checked him on instinct. Medic reflexes she couldn't shut off, but there was nothing to be done. 3 rounds to the chest, dead before he hit the ground. Agents swarmed Khalil, zip-tied his hands, pulled him away from Claire. Vasquez appeared, surveying the carnage. You okay? Claire stood on shaking legs. Define okay. Not shot, not dead. Then yeah, I'm okay. Vasquez looked at Khalil, now surrounded by armed agents, then back at Claire. You had a gun to his head. Why didn't you shoot? Claire met her eyes. Because I'm not him. I don't take lives. I save them. Even his? Especially his. Because that's what makes me different. Khalil was being dragged toward the exit. He looked back at Claire. Something unreadable in his expression. Not defeat, not anger. Something closer to understanding. Then he was gone. Vasquez holstered her weapon. Dylan and Kozak are both alive, wounded but stable. The agent who went down in the stairwell didn't make it. Claire closed her eyes. What was his name? Thomas Riley, father of 2. 8 years with the Bureau. I'm sorry. He knew the risks. They all did. That doesn't make it better. No, it doesn't. They stood in silence for a moment, surrounded by the wreckage. Then Vasquez's radio crackled. Director, we've got a situation. News crews outside. They're reporting shots fired inside the hospital. We can't keep this quiet anymore. Vasquez looked at Claire. You ready for round 2? What do you mean? I mean you just took down an international terrorist with nothing but a borrowed gun and medical training. That's going to be a hell of a story, and everyone's going to want to hear it. Claire looked at the blood on her hands. Some hers, some Khalil's, some from the agent she'd tried and failed to save. She thought about Tessa, about Karen, about all the people downstairs who'd watched her walk away from dying patients to chase a threat. She thought about Lieutenant Cole, about Colonel Hayes, about Dr. Voss and his calculated press conference. She thought about who she'd been and who she was now and who she was becoming, whether she wanted to or not. No, Claire said quietly. No? No more stories, no more press conferences, no more using my life as a headline. Claire started walking toward the door. I've got patients downstairs who need me. That's my job. That's all I want it to be. Claire. But she was already gone. The ER was still chaotic when Claire returned. Dr. Harmon looked up from a patient, saw her, and his face went pale. What happened? Later, Claire said, pulling on fresh gloves. What do you need? Bay 3, possible internal bleeding. I need a second set of hands. Claire moved without hesitation. For the next 3 hours, she worked. Treated patients, saved lives, did her job. No cameras, no reporters, no drama, just medicine. When her shift finally ended, she found Tessa waiting by her locker. You're really okay? Tessa asked. I'm really okay. People are saying, whatever they're saying, it's probably exaggerated. Tessa studied her face. You're not going to talk about it, are you? Nope. Not even to me? Especially not to you, because the more people who know, the bigger it becomes. And I'm done being bigger than I want to be. Tessa nodded slowly. For what it's worth, I'm glad you're safe. Me too. Claire grabbed her bag and headed for the exit. She was halfway to her car when she saw him, Lieutenant Ethan Cole, standing in the parking lot, still in uniform. He straightened when he saw her. Captain Whitmore. I told you, it's just Claire. I know, but after what happened today... He stopped, searching for words. I wanted to say I'm sorry. Again. For not seeing who you were. For making assumptions. For being an ass. Yeah, we covered that already. For being afraid, Cole finished. I was afraid of you. Of what you represented. Someone better than me, more experienced, more capable. And instead of learning from you, I tried to diminish you. That was cowardice. Claire looked at him for a long moment. You know what the difference is between fear and cowardice? What? Fear is natural. Cowardice is a choice. You were afraid. But when it mattered, when you had to decide whether to keep defending your ego or admit you were wrong, you chose right. That's not cowardice. That's growth. Cole's expression shifted. I still owe you. You don't owe me anything. Then let me buy you coffee. No agenda. No apologies. Just 2 people who had a really bad first impression trying to have a normal conversation. Claire started to say no. Started to retreat into the safety of isolation, of anonymity, of being alone. Then she thought about everything that had happened, about being hunted, about being used, about being forced into the spotlight whether she wanted it or not. Maybe running wasn't the answer anymore. Maybe standing still was. Okay, she said. Coffee. Cole smiled. Tomorrow? Tomorrow. He walked away, and Claire got into her car. She was about to start the engine when her phone rang. Unknown number. She almost didn't answer, but something made her pick up. Ms. Whitmore? A voice she didn't recognize. Young, female, scared. Yes? My name is Sarah Riley. I was Agent Thomas Riley's daughter. Claire's hand tightened on the phone. I'm so sorry for your loss. They told me what happened, what my dad did, how he... The voice cracked. How he protected you. And I just wanted to say thank you for trying to save him. The other agents told me you tried. Even after everything, you tried. Claire's throat tightened. I wish I could have done more. My dad always said the best people are the ones who try, even when they know it's impossible. He would have liked that about you. A pause. I'm not calling to make you feel guilty or anything. I just wanted you to know that his life mattered, and what you do matters. And another pause, longer this time. And I want to be like you someday. I'm pre-med at State University. I want to save lives the way you do. Claire closed her eyes, feeling the weight of those words. Then study hard, she said softly. Listen to your instructors. Practice until your hands move without thinking. And remember that every life you save is a whole world you keep from ending. Your father understood that. He proved it today. Thank you, Sarah whispered. The line went dead. Claire sat in the car, staring at nothing, feeling everything. Then she drove home. Her apartment was exactly as she'd left it. Empty. Quiet. Safe. She dropped her bag, kicked off her shoes, and collapsed onto the couch. Her phone buzzed. Another message. This time from Colonel Reeves. The offer still stands. We could use someone like you. Claire read it twice. Then she typed a response. I'll think about it. She hit send before she could change her mind. Another message appeared immediately. This one from Tessa. News is saying you're a hero. Are they right? Claire smiled faintly and typed back. I'm just a nurse. She set the phone down and closed her eyes. For the first time in 2 days, she let herself feel it all. The fear, the adrenaline, the loss, the weight of Agent Riley's death, the impossibility of Sarah Riley's hope, the reality that her quiet life was gone forever, burned away by circumstances she couldn't control and choices she'd had to make. But underneath all of that, something else. Something she hadn't felt in a long time. Purpose. Not the forced purpose of military service, not the quiet purpose of anonymous nursing, but something in between. Something that acknowledged who she'd been while accepting who she was becoming. Someone who saved lives. Someone who didn't run. Someone who stood still and faced what came, no matter how terrifying. She was drifting towards sleep when her phone rang one more time. She grabbed it without looking. What? Captain Whitmore. The voice was familiar but wrong, not hostile, not friendly, something in between. This is Rashid Khalil. Claire sat up, instantly awake. How I got this number doesn't matter. What matters is that we need to talk. You're in federal custody. You can't... I was in federal custody. Past tense, I've been released. That's not possible. Nothing is impossible with the right leverage. And I have leverage you can't imagine. His voice was calm, almost conversational. I'm calling to tell you 3 things. First, what happened today, the attack, the vendetta. It's over. You were right. Revenge doesn't bring back what I lost. It just creates more loss. So you're giving up. I'm choosing a different path. Which brings me to the second thing. The translator you saved, Bashar Hadid, he died 3 months ago. Car accident and witness protection. The information he provided led to arrests, yes, but it also led to his death. The people he betrayed found him anyway, and they made sure he knew why he was dying. Claire's blood ran cold. Why are you telling me this? Because you need to understand that the lives you save don't always stay saved. You can do everything right and still lose. That's the world we live in. Khalil paused, but that doesn't mean we stop trying. It just means we accept the cost. And the third thing? The third thing is a warning. Yesterday's attack was funded by people who see you as a symbol, not as a person. A symbol of American military power, of intervention, of everything they oppose. I was just the instrument, but there are others, and they don't have my restraint. They don't care about honor or rules or innocent casualties. Are you threatening me? I'm warning you. Because despite everything, I respect what you did. You had a gun to my head and you didn't pull the trigger. That took courage most people don't have. So I'm giving you the courtesy of knowledge. They're coming. Not today, not tomorrow, but eventually. And when they do, they won't stop until you're dead or they are. The line went dead. Claire stared at the phone, her mind racing. Khalil was free. There were others coming. The fight wasn't over. It was just beginning. Claire didn't move for a full minute after the call ended, just sat there, phone in hand, Khalil's words echoing in her mind. They're coming. Not today, not tomorrow, but eventually. She stood, paced to the window, looked out at the city lights. Somewhere out there, people who saw her as a symbol were planning, preparing, and Khalil, a man who'd just tried to kill her, had called to warn her. The world had stopped making sense. Her phone rang again. This time she recognized the number. Deputy Director Vasquez. Claire answered. He just called me. I know. We were monitoring his line. He used a burner, ditched it immediately after. Vasquez's voice was tight with barely controlled fury. How the hell did he get released? That's what I want to know. Political pressure. His government made calls. Threatened to withdraw cooperation on 3 active investigations unless we let him walk. State Department caved. The bitterness in Vasquez's voice was sharp. We had him. We had evidence, witnesses, everything, and he walked out the front door 6 hours after we brought him in. Claire's jaw clenched. So what happens now? Now you disappear, for real this time. New identity, new city, protection, until... No. Claire, I said no. I'm done running. I'm done hiding. If there are people coming after me, then we deal with them. But I'm not spending the rest of my life looking over my shoulder. Vasquez was quiet for a moment. You understand what you're saying? These aren't amateurs. These are organized, funded, motivated. They will keep coming. Then we'll keep stopping them. It's not that simple. It never is. Claire sat back down, her decision solidifying. What did you find out about who funded Khalil? We're still tracing the money. Shell companies, offshore accounts, layered transactions. But we have a lead, a name that keeps appearing in the financial records. Victor Breslin. Claire frowned. Who? Defense contractor, former military, dishonorably discharged 10 years ago for illegal arms sales. He's been operating in the gray market ever since, selling weapons, intelligence, services to anyone who can pay. And according to our analysis, he paid Khalil $2 million to orchestrate yesterday's attack. Why would a defense contractor want me dead? That's what we're trying to figure out. But there's something else. Breslin has connections to Redwood City Medical Center. He sits on the hospital's board of directors. The words hit like a physical blow. What? He's been on the board for 3 years. Major donor. His foundation contributed over $5 million to the hospital's expansion project. He has access to personnel files, schedules, security protocols, everything Khalil would have needed to plan the attack. Claire's mind raced. Does the hospital know? Not yet. We're keeping it quiet until we have concrete evidence. But Claire, if Breslin is involved, this goes deeper than revenge. This is something else entirely. Then find out what, and find out fast. We're trying, but in the meantime, you need protection. Real protection, not just a safe house. I'll handle it. How? Claire looked at her phone, at the messages she'd received. Colonel Reeves' offer, Major Vance's insistence. The military wanted her back, and right now that didn't sound like the worst idea. I've got a call to make, Claire said, and hung up before Vasquez could argue. She pulled up Colonel Reeves' number and dialed. He answered on the second ring. Captain Whitmore, I wasn't expecting to hear from you so soon. The consulting position, is it still available? A pause. Yes, but I thought you weren't interested. I changed my mind. When can we start? Tomorrow if you want. We've already got a training facility prepared. I can have a team pick you up at 0600. Make it 0700. I have something to do first. Copy that. Captain, why the sudden change? Claire looked out the window again at the city that had become both sanctuary and battlefield. Because you were right. I can't keep running from who I was. And right now, who I was might be exactly who I need to be. She hung up and tried to sleep. Failed. Spent the rest of the night staring at the ceiling, playing through scenarios, calculating risks. At 5:30 a.m., she gave up and got ready. By 6 a.m., she was pulling into the hospital parking lot for what she told herself would be a quick stop. Just needed to clear out her locker, say goodbye to the few people who deserved it. The ER was already busy when she arrived. Karen was at the nurse's station, looking exhausted. You're early, Karen said. Can't stay long, just wanted to grab my things. Karen studied her face. You're leaving. It wasn't a question. Yeah. Because of what happened. Because staying puts everyone here at risk. As long as I'm working in this hospital, people who want me dead will keep coming, and I won't let innocent people get caught in the crossfire. Karen's expression softened. We're going to miss you. I'll miss you too. Tessa appeared from one of the trauma bays, saw Claire, and her face crumpled. No, you can't leave. Not after everything. I have to. Why? Because some asshole made threats? Because the hospital is too scared to protect you properly? That's not fair. Life's not fair. You taught me that. I didn't teach you to run. Claire stepped closer, voice low. I'm not running. I'm choosing a different battlefield. One where the people around me are trained for what's coming, where I'm not putting civilians at risk every time I show up for work. Tessa wiped her eyes. What are you going to do? Train combat medics. Teach them everything I know. Make sure the next generation is better prepared than I was. That sounds noble. Also sounds lonely. Maybe, but it's the right choice. Before Tessa could respond, Dr. Harmon approached, holding a tablet. Claire, can we talk? They moved to his office. Harmon closed the door and turned to face her. I heard you're resigning, he said. News travels fast. Karen told me. She's worried about you. She shouldn't be. I'll be fine. Harmon set down the tablet. I need to tell you something. About Dr. Voss. Claire's attention sharpened. What about him? He's been acting strange. Ever since the press conference, he's been in closed-door meetings with the board, making calls, getting defensive when I ask questions. Harmon ran a hand through his hair. Yesterday, I overheard him talking to someone on the phone. He mentioned your name, said something about containing the situation and limiting exposure. Did he say who he was talking to? No, but Claire, I've worked with Voss for 5 years. I've never seen him this rattled. It's like he's scared of something or someone. Claire's mind connected the dots. Victor Breslin sat on the hospital board. Voss was taking orders from the board, which meant Voss was potentially taking orders from the man who'd funded the attack on her. Thanks for telling me, Claire said quietly. What are you going to do? What I should have done from the beginning. Stop letting other people control the narrative. She left Harmon's office and headed straight for the administrative wing. Dr. Voss's office was on the 3rd floor, behind a secretary's desk that was currently empty. Claire walked past it and opened Voss's door without knocking. He looked up from his computer, startled. Miss Whitmore, what are you? You can't just... Who's Victor Breslin to you? Voss's face went pale. I don't know what you're talking about. Yes, you do. He's on the hospital board, he's a major donor, and he's the man who funded the attack that nearly killed 6 people in your emergency room. Claire stepped closer. So I'll ask again, who is he to you? Voss stood, trying to reclaim authority. This is completely inappropriate. You need to leave my office immediately, or I'll call security. Call them. While you're at it, call the FBI. I'm sure they'd love to hear about your closed-door meetings and your conversations about containing the situation. Voss's hand froze halfway to the phone. You don't understand. This is complicated. There are factors you're not aware of. Then explain them. He sat down slowly, suddenly looking much older. Breslin approached me 6 months ago, said he had concerns about hospital security, wanted to make a substantial donation to upgrade our systems, hire better personnel. It seemed generous. I didn't question it. What changed? 2 months ago, he started asking questions about staff, about schedules, about you specifically. I didn't think much of it at first. Your military background was in your personnel file. It wasn't classified. But then he asked for your home address, your phone number. I refused. But you gave him something. Voss looked away. I gave him access to the staff scheduling system. He said it was for a security audit. I believed him. Claire's hands clenched. That's how Khalil knew when I'd be working, how he knew exactly when to strike. I didn't know. I swear I had no idea he was planning. Voss's voice cracked. When the attack happened, when I realized what he'd done with the information I'd provided, I tried to distance the hospital. I thought if I made you the face of our response, if I announced the new program, it would show we were taking action, that we weren't complicit. You used me as a PR shield. I was trying to protect the hospital. You were trying to protect yourself. Claire leaned against the desk. Where's Breslin now? I don't know. He stopped attending board meetings 2 weeks ago, stopped returning calls. It's like he disappeared. Or he's waiting, watching to see if his plan worked. Voss looked up, fear clear in his eyes. What are you going to do? I'm going to find him, and I'm going to make sure he can't hurt anyone else. Claire moved toward the door, then stopped. You're going to resign, today. You're going to cite personal reasons, accept responsibility for security failures, and you're going to recommend Dr. Harmon for your position. Because you're right about one thing. This hospital needs better leadership, and it sure as hell isn't you. Boris. Yeah. She left before he could respond. By 7 a.m., Claire was in the parking lot when the military transport arrived. Colonel Reeves stepped out, followed by two junior officers. Captain Whitmore, ready to go? One more stop first. I need to talk to the FBI. Reeves raised an eyebrow, but didn't argue. Where? Their field office, downtown. They drove in silence. Claire used the time to call Vasquez, who agreed to meet them immediately. The FBI field office was a concrete fortress, all security checkpoints and bulletproof glass. Vasquez met them in a conference room on the fourth floor, spreading files across the table. Victor Breslin, she said, pointing to a photograph, age 47. Dishonorable discharge from the Army in 2016 following an investigation into illegal weapons sales to foreign nationals. He avoided prison through a plea deal that required him to testify against his co-conspirators. Since then, he's rebuilt his fortune through a private defense contracting firm. Claire studied the photo. Breslin was ordinary looking. Average height, graying hair, the kind of face you'd forget 5 minutes after seeing it, which was probably intentional. What's his connection to me? Claire asked. We're still piecing that together, but we found something interesting in the financial records. 3 years ago, Breslin tried to secure a contract with the Department of Defense for a new combat medical training program. He claimed to have revolutionary techniques that would reduce battlefield mortality by 30%. That's impossible. The DoD agreed. They rejected his proposal, but before they did, they consulted with military medical personnel to evaluate his claims, including someone from your unit. Claire's stomach dropped. Who? Vasquez slid another file across the table. Captain David Morrison, your commanding officer during Operation Sandstorm. The name hit like a sledgehammer. Morrison. The man who'd recommended her for commendations she'd refused. The man who'd tried to convince her to stay in the military when she'd submitted her discharge papers. The man who'd told her she was wasting her potential. Morrison evaluated Breslin's proposal? Claire asked. And rejected it. Quite harshly, according to the report. Called it dangerous pseudoscience and a waste of taxpayer money. Breslin appealed the decision. Morrison testified against him in the appeal hearing. Breslin lost everything, his credibility, his investors, his reputation. Claire was starting to see the shape of it. So this isn't just about me, it's about Morrison. We think so, but Morrison died 8 months ago. Heart attack during a training exercise, which means Breslin's revenge target was already gone. So he came after me instead. The medic Morrison praised, the one who made his techniques look effective by comparison. Vasquez nodded. It's a theory, but it fits the timeline. Breslin joined the hospital board 9 months ago, 1 month after Morrison's death. He started asking about you 6 months ago. The attack happened 2 days ago. Colonel Reeves spoke up for the first time. This is a long game. Years of planning, millions of dollars invested, all for revenge against someone who died before he could complete it. That's not rational. Revenge rarely is, Claire said quietly. Vasquez pulled up a map on her tablet. We've been tracking Breslin's known associates and properties. He owns a warehouse facility 40 miles outside the city. Remote location, heavy security, no public access. We're getting a warrant to search it. How long? Judge is reviewing it now. Should have it within the hour. Claire stood. I'm coming with you. Absolutely not. This is a federal operation. We can't have civilians. I'm not a civilian. I'm active military consultation as of 1 hour ago. Claire looked at Reeves. Right? Reeves hesitated, then nodded. Technically, yes. You're under contract with Fort Brennan. That makes you DoD personnel. Vasquez looked between them, clearly unhappy. Fine. But you stay behind the tactical team. No heroics. We clear? Clear. By 9:30 a.m., they were assembled outside Breslin's warehouse. FBI tactical team, local SWAT, military advisors. Claire wore a borrowed tactical vest, stayed near the command vehicle as ordered. The warrant came through at 9:47 a.m. The breach team moved in fast. Shape charges on the main door, flashbangs through the windows, agents flooding in with weapons raised. Claire watched on the video feeds, her heart pounding. The warehouse was mostly empty. Old equipment, dusty storage containers, nothing obvious. Then one of the agents called out, "Got a door here. Looks like it leads underground." The feed switched to helmet cam footage, a metal staircase descending into darkness. The team moved down carefully, weapons sweeping. At the bottom was a corridor, and at the end of the corridor was a room. What they found inside made Claire's blood run cold. A medical facility, complete with operating tables, monitoring equipment, IV stands. But everything was wrong. The instruments were modified. The medications were labeled in ways that didn't make sense. And on the walls were photographs. Photographs of soldiers, dozens of them. some in hospital beds, some in coffins. And in the center of it all was Victor Breslin. He stood calmly, hands at his sides, no weapon visible. Behind him was a bank of computer servers, screens showing data that scrolled too fast to read. "That's far enough," Breslin said. The tactical team froze. "I'm unarmed," Breslin continued. "You can arrest me if you want, but before you do, you should know what you're looking at." Vasquez's voice came through the comms. "What are we looking at, Mr. Breslin?" "The future of combat medicine, the program Morrison rejected, the techniques I spent 15 years developing." Breslin gestured to the equipment around him. "I was right. I could have saved thousands of lives. But Morrison was too proud, too traditional, too stupid to see it. So he destroyed me." "So you tried to kill Captain Whitmore." "I tried to prove a point. The convoy attack was designed to create maximum casualties that would require immediate advanced trauma care. I knew Whitmore would respond. I knew she'd save them using Morrison's outdated techniques. And I knew it would bring attention to the fact that those techniques are inferior to mine." Claire was listening through the command vehicle's speakers. Her hands were shaking with rage. "You killed people to prove a point?" Vasquez's voice was cold. "I funded an operation that created a controlled medical crisis. A demonstration. And it worked. Whitmore performed exactly as predicted. She saved 6 people using standard protocols, but with my techniques, she could have saved them faster, with less resource expenditure, with better long-term outcomes. You're insane. I'm a visionary, and history will prove me right." Breslin smiled. "But you'll never know for sure, because everything I've developed is encrypted on these servers. And if you try to arrest me, if you try to seize this equipment, I'll wipe it all. 15 years of research. Gone." Vasquez looked at the tactical team leader, who shook his head. The servers were probably rigged with deadman switches. Moving Breslin could destroy everything. Claire had heard enough. She pushed past the agents at the command vehicle and headed for the warehouse entrance. "Captain Whitmore, stand down!" Vasquez shouted. Claire kept walking. She descended the metal stairs, moved through the corridor, and stepped into the medical facility. Breslin turned to look at her. "Captain Whitmore, I was hoping you'd come. You wanted my attention. You've got it. Do you know why Morrison really rejected my proposal? Because it was dangerous. Because it was better than his methods, better than yours. And he couldn't stand the idea that someone outside his sacred military medical establishment had found a better way." Breslin moved to one of the computer terminals. "I've watched your career. You read your reports. You're talented, dedicated, but you're working with outdated techniques. Imagine what you could do with access to my research. I'd burn it. Even if it could save more lives? Especially then, because you didn't develop these techniques to save lives. You developed them to prove Morrison wrong, to feed your ego, and that makes them worthless." Breslin's smile faded. "You sound just like him." "Good." His hand moved toward the keyboard. "Then you can watch it all disappear." Claire didn't give him the chance. She moved fast, closed the distance between them, grabbed his wrist before his fingers touched the keys. Breslin tried to pull away, but she was stronger, faster, trained for exactly this kind of confrontation. The tactical team rushed in, pulled Breslin away, secured him. He fought against them, screaming, "You don't understand. This was important. This mattered." "So did the people you killed," Claire said quietly. They dragged him out. Vasquez appeared at Claire's side. "That was incredibly stupid. But it worked. We could have lost all the evidence. Or he could have deleted it while you were still debating options." Claire looked at the servers, at the research Breslin had obsessed over for 15 years. "Can your people decrypt this?" "Eventually, but it'll take time." "Then take it, study it. If there's anything actually useful buried in his madness, use it, because he was right about one thing. We should always be looking for better ways to save lives. We just shouldn't kill people to prove it." They walked back up to the surface together. Outside, Breslin was being loaded into a federal transport vehicle. He caught sight of Claire one last time. "You'll regret this," he shouted. "When soldiers die because you rejected progress. When people die because you were too proud to see." The door slammed shut, cutting him off. Vasquez turned to Claire. "He'll go away for a long time. Conspiracy to commit murder, terrorism charges, illegal medical experimentation if we can prove he tested these techniques on anyone. He's done. What about the hospital board? He had access because of them. We're investigating everyone who gave him clearance. Voss included." Claire nodded, suddenly exhausted. "I need to go." "Where?" "Fort Brennan. I've got combat medics to train." Vasquez extended her hand. "Thank you for everything." Claire shook it. "Just doing my job." She climbed into the military transport where Colonel Reeves was waiting. "Feel better?" he asked. Not really, but at least it's over. Is it? Claire looked at him sharply. What do you mean? Reeves pulled out a tablet, showed her a classified intelligence report. This came through while you were inside. Remember Khalil's warning about others coming? Yeah. He wasn't lying. We've intercepted communications from 3 separate groups, all discussing you, all planning operations, and all connected to a single source, someone who's been funding anti-American operations for the past 5 years, someone who sees you as a symbol worth eliminating. Claire's exhaustion evaporated. Who? We don't have a name yet, just a code name, the Architect. And according to our intelligence, Khalil and Breslin were both working for him. They were just the opening moves. Claire stared at the report, watching everything she thought was finished suddenly expand into something much larger. So this really was just the beginning, she said quietly. I'm afraid so. Then I guess it's good I took the job. Reeves smiled faintly. Welcome back to the fight, Captain. The transport pulled away from the warehouse, heading toward Fort Brennan. Behind them, FBI agents swarmed Breslin's facility, cataloging evidence, securing servers, dismantling the medical equipment he'd built his obsession around. Claire watched it all disappear in the rearview mirror. Then her phone buzzed. Unknown number. Again. She answered without hesitation. If this is another threat, I'm really not in the mood. Not a threat? A gift. The voice was electronically distorted. Impossible to identify. You stopped Breslin. Impressive. Khalil said you were formidable. I'm beginning to see why. Who is this? Someone who appreciates talent. You've been playing defense, Captain Whitmore, reacting to attacks, protecting yourself. But what if I told you there was another way? I'm listening. The people who want you dead. They see you as a symbol of American intervention, of military power, of everything they oppose. But symbols can be useful. Symbols can be turned, used for purposes their creators never intended. Claire's grip tightened on the phone. Get to the point. The point is that I'm offering you a choice. Keep fighting, keep defending, keep waiting for the next attack. Or work with me. Help me reshape what you represent. Turn their weapon against them. You want me to betray my country. I want you to transcend it. You're too valuable to waste on nationalism and flags and causes that will forget you the moment you're no longer useful. I can offer you something better. Purpose. Power. The ability to actually change things instead of just patching holes. And if I refuse, then the attacks continue, escalate. Eventually, one succeeds. Or maybe you survive, but everyone around you dies. Your friends, your colleagues, the patients you try to save. The voice paused. I've already put pieces in motion, people you trust, places you think are safe. Nothing is certain anymore, Captain, except that I'm giving you the chance to control your own fate instead of letting it control you. The line went dead. Claire sat frozen, the phone still pressed to her ear. Colonel Reeves was watching her. What was that? The Architect. He just made me an offer. What kind of offer? Claire looked at the phone, then out the window at the city passing by. At the hospital in the distance where Tessa and Karen were working, unaware of the new threat. At the future she'd thought was starting to take shape. The kind that means this is much worse than we thought. Colonel Reeves leaned forward, his face tense. What did he say exactly? Claire replayed the conversation in her mind, weighing every word. He said he's already put pieces in motion. People I trust. Places I think are safe. That could mean anything. Could be a bluff. Or it could mean someone close to me is compromised. Claire pulled out her phone, started scrolling through contacts. Tessa, Karen, Harmon, Vasquez, even Reeves himself. Anyone could be the threat. Anyone could be working for the Architect. We need to get you to Fort Brennan. Secure location. Controlled access. We can... No. Claire's voice was firm. That's exactly what he wants. Me, isolated, paranoid, second-guessing everyone. That's how he wins. Then what do you propose? Claire was quiet for a long moment, thinking through the angles. The Architect had made one critical mistake. He'd revealed himself too early. Breslin was in custody. Khalil was on a watch list. The threat was known, which meant it could be anticipated. Managed. We set another trap, Claire said. But this time, I'm the bait by choice, not by circumstance. Reeves shook his head. You just got done with one trap. You really want to walk into another? I want to end this, permanently. And the only way to do that is to draw the Architect out. Make him commit resources. Make him show his hand. How? Claire looked out the window at the hospital growing smaller in the distance. At the city where she'd tried to disappear and failed. At the life she'd thought she could build by staying quiet and invisible. That version of herself was gone, burned away by circumstances she couldn't control and choices she'd had to make. But maybe that wasn't a loss. Maybe it was evolution. I go public, Claire said. Full press conference, no prepared statements. I tell them everything. Operation Sandstorm, Breslin, Khalil, the architect. I make myself the biggest target possible. And when he comes for me, we're ready. Reeves was silent for a long moment. That's incredibly dangerous. Everything about this is dangerous. At least this way, we control the timing. The brass will never approve it. Then don't tell them until it's done. Reeves studied her face, looking for doubt, for hesitation. He found none. Finally, he nodded. When? Today, this afternoon. We don't give him time to adjust his plans. I'll need to coordinate with the FBI, with hospital security, with... Just get me a room full of reporters and cameras. I'll handle the rest. By noon, they were back at Redwood City Medical Center. The hospital's main conference room had been transformed into a media circus. Cameras, lights, reporters from every major outlet crammed into folding chairs. Vasquez had tried to shut it down, argued that it was reckless, but Claire had made the call herself. Invited the press. Told them she'd answer every question they had. No more hiding, no more half-truths. Just the raw, ugly reality of what her life had become. She stood backstage waiting. Tessa appeared at her elbow, eyes wide. Are you sure about this? No, but I'm doing it anyway. What if he's watching? What if this is exactly what he wants? Then he'll make a move, and we'll be ready. Claire turned to face her. Tess, I need you to do something for me. Anything. After this press conference, I want you to leave the hospital. Take the rest of the day off. Go somewhere public, somewhere with lots of people. And don't come back until I give you the all clear. Tessa's face went pale. You think something's going to happen. I think I'd rather be paranoid and wrong than careless and right. What about Karen? Harmon. Already arranged. Vasquez is pulling them out under the guise of witness protection interviews. Everyone who matters will be safe. Except you. I'll be surrounded by federal agents and military personnel. I'll be fine. Tessa didn't look convinced, but she nodded. Okay. But Claire, when this is over, when you've caught this guy and everything goes back to normal, don't disappear again. Don't just vanish to some military base and pretend we didn't matter. Claire felt something tighten in her chest. You matter. All of you. More than you know. Then prove it. Stay in touch. I will. Tessa hugged her quickly, fiercely, then left. Claire stood alone for a moment, listening to the murmur of voices from the conference room. Then she walked out onto the small stage. The room erupted. Camera flashes shouted questions, the overwhelming noise of dozens of people all trying to be heard at once. Claire stepped to the podium and waited. Gradually, the room quieted. My name is Claire Whitmore, she began. 4 days ago, I was a nurse working the afternoon shift in this hospital's emergency department. I was quiet, anonymous, invisible. That's how I wanted it. But circumstances have made invisibility impossible. So instead, I'm going to tell you the truth. For the next 20 minutes, she laid it all out. Operation Sandstorm, the translator she'd saved, Rashid Khalil's vendetta, Victor Breslin's obsession, the architect's threat. She didn't soften it, didn't sanitize it, just spoke plainly about violence and revenge and the cost of saving lives in a world where some people saw compassion as weakness. When she finished, the room was silent. Then the question started. Ms. Whitmore, are you saying you're currently under active threat? Yes. Do you believe the hospital is safe? I believe we've taken every precaution possible, but there are no guarantees. Why are you telling us this now? Why not stay in protective custody? Claire looked directly into the camera. Because I'm tired of hiding. Because the people threatening me want me to live in fear, and I refuse. And because the person orchestrating these attacks, the one who calls himself the architect, needs to understand that I'm not a symbol he can manipulate or a target he can eliminate. I'm a person, and I'm standing right here. More questions, more answers. Claire fielded them all with the same calm directness, never wavering, never backing down. Then a reporter in the back raised his hand. Ms. Whitmore, there are people who say you're being reckless, that by putting yourself in danger, you're also endangering everyone around you. How do you respond to that? I'd say they're right. This is reckless. But sometimes reckless is the only choice left when all the careful options have been exhausted. I tried quiet. I tried invisible. It didn't work. So now I'm trying something else. And if it gets you killed, then at least I'll die standing up instead of hiding. The press conference ended 40 minutes later. Claire walked off stage to find Vasquez waiting, her expression grim. That was either the bravest or stupidest thing I've ever witnessed, Vasquez said. Probably both. We've got agents positioned throughout the building, snipers on adjacent rooftops, tactical teams on standby. If the architect makes a move, we'll see it coming. Unless he's already inside. Vasquez's jaw tightened. We've vetted everyone, staff, security, maintenance, background checks, cross-references, the whole protocol. And if he recruited someone after you vetted them, if he's been watching, waiting, preparing for exactly this scenario, then we adapt. But Claire, you need to trust us. We're good at our jobs. I know, that's why I'm still alive. They moved through the hospital corridors, surrounded by agents dressed as hospital personnel. To a casual observer, everything looked normal. But Claire could see the tells, the earpieces, the slight bulges under jackets where weapons were concealed, the way they positioned themselves to cover angles and exits. This was a fortress disguised as a hospital. They reached a secure room on the 4th floor, originally a doctor's lounge, now converted into a command center. Monitors showed feeds from dozens of security cameras. Radio chatter filled the air as agents reported in from their positions. Colonel Reeves was there, coordinating with military intelligence. He looked up when Claire entered. We just intercepted communications. Someone's planning an attack on the hospital within the hour. Claire's pulse quickened. Source? Encrypted messaging app. We can't trace the sender, but the target is clear. You. How many hostiles? Unknown. Could be one. Could be a team. But they're coming. Vasquez moved to the monitors, started issuing orders. Lock down all entrances. No one in or out without clearance. Get the civilian staff to secure locations. And find me the source of that message. The next 30 minutes were tense. Claire watched the monitors, looking for anything unusual. But the hospital just continued its normal rhythm. Patients being admitted, staff moving between departments, visitors coming and going. Then one of the agents monitoring the cameras spoke up. I've got movement. Parking garage, level 3. Male, 30s. Wearing maintenance uniform. He's not on the staff roster. Vasquez leaned closer. Can you get a better angle? The camera zoomed in. The man's face became clear. Claire recognized him immediately. One of Khalil's team, the one who'd gotten away during the stairwell firefight. He's here for me, Claire said. Let him come, Vasquez replied. We've got him contained. The moment he makes a hostile move, we take him down. They watched the monitor. The man moved through the parking garage, heading for the stairwell entrance. He was carrying something, a bag, maybe tools. Hard to tell from the angle. He reached the door, pulled out a key card. It worked. Vasquez swore. How did he get clearance? Someone gave it to him, Claire said quietly. Someone inside. The realization hit them all simultaneously. The architect hadn't just sent an attacker. He'd placed an asset inside the hospital's security team, someone with access, someone who could open doors and disable alarms and create blind spots in the surveillance. Find out who issued that key card, Vasquez barked. Now! Agents scrambled. Claire watched the monitor as the hostile moved into the stairwell, climbing steadily toward the upper floors, toward the command center, toward her. We need to evacuate, Reeves said. No, Claire replied. We need to finish this. Claire, he's not just here to kill me. He's here to prove the architect can reach me anywhere, anytime. If I run now, if I hide, he wins. The attacks continue. The threat remains. Claire turned to face them. But if we stop him here, if we prove that every move the architect makes fails, we break his power. We show him he's not untouchable. Vasquez studied her for a long moment. Then she nodded. All right, we do this your way. But you stay behind cover. We handle the takedown. Claire agreed. The hostile reached the 4th floor. The camera showed him exiting the stairwell, moving down the corridor. He was 30 feet from the command center. 20. 10. Vasquez gave the signal. Agents poured out from hidden positions, weapons drawn, shouting commands. The hostile froze, hands rising slowly, too slowly. His hand moved toward his jacket. Claire saw it in slow motion, the reach, the draw, the weapon clearing leather. Gunshots. 3. 4. The hostile went down hard, blood spreading across the polished floor. Agents swarmed him, kicked the weapon away, checked for vitals. He's alive, one of them called. Barely. Claire moved before anyone could stop her. She pushed through the agents, knelt beside the bleeding man, assessed his injuries. 2 shots to the torso, 1 to the shoulder. Critical but survivable if treated immediately. Her hands moved on instinct, applying pressure to the worst wound, checking for exit wounds, calculating blood loss. Get me a trauma kit, she said. An agent handed her one. Claire worked fast, packing the wounds, establishing an airway, monitoring pulse. The hostile's eyes were open, staring at her with a mixture of pain and confusion. Why? He gasped. Because killing you doesn't solve anything. Claire replied, not stopping her work. But keeping you alive gives us information, gives us leverage, gives us a way to end this. She stabilized him enough for transport. Paramedics arrived, took over, wheeled him toward the ER. Vasquez appeared at Claire's side. The keycard was issued by Thomas Brenner, hospital security supervisor. We're bringing him in now. He's working for the architect. Looks that way, but we'll get confirmation soon enough. They found Brenner in the security office, trying to wipe surveillance footage. He saw them coming and bolted, but agents tackled him before he made it 10 feet. Within minutes, he was cuffed, read his rights, and placed in federal custody. I want a lawyer, Brenner said, his voice shaking. You'll get one, Vasquez replied, right after you tell us who you're working for. I don't know what you're talking about. We have you on camera issuing an unauthorized keycard to a known terrorist operative. We have evidence of you tampering with surveillance systems. We have testimony from multiple federal agents. You're going away for a very long time. Your only chance at reducing your sentence is cooperation. Brenner's face crumpled. He said he'd kill my family, my wife, my daughter. He showed me pictures of them, told me exactly where they'd be. What would happen if I didn't help? Who? I don't know his name, just a voice on the phone. He knew things, personal things, things no one should know. He said if I helped him get to Whitmore, he'd leave my family alone. If I refused, they'd die. Vasquez's expression softened slightly. Where's your family now? Safe house. I sent them away yesterday. Told them I needed them out of the city. Smart. We'll make sure they stay protected, but you need to tell us everything. Every communication, every instruction, every detail. Brenner talked. For the next hour, he laid out the architect's plan, how he'd been approached, what he'd been asked to do, the timeline of the attack. It wasn't much, but it was something. Another piece of the puzzle. By evening, the hospital had returned to something resembling normal. The hostile was in surgery, expected to survive. Brenner was in federal custody, cooperating fully. The threat had been neutralized, but Claire knew it wasn't over. She stood in the parking lot, watching the sun set over Redwood City, when her phone rang. The architect. She answered. Your man failed. I know. I watched the whole thing. Very impressive. The distorted voice sounded almost amused. You saved his life. Even after he came to kill you. That's either compassion or stupidity. It's strategy. He's more valuable to me alive than dead. Perhaps. But you've made a critical error, Captain Whitmore. What's that? You've assumed this was about you. It never was. You're just the catalyst, the trigger, the thing that sets everything else in motion. The voice paused. Check your email. I've sent you something. A gift, really. Call it professional courtesy. The line went dead. Claire opened her email. One new message, no subject, sent from an encrypted address. She opened it. Inside was a single video file. She hit play. The footage showed a warehouse, the same one where they'd arrested Breslin, but the timestamp was wrong. This was from before the raid, days before. The camera showed Breslin working at his computer. Then someone entered the frame. Claire's blood went cold. It was Dr. Leonard Voss. In the video, Voss and Breslin talked. The audio was clear. The FBI is getting close, Voss was saying. You need to shut this down. I can't. Not yet. The demonstration isn't complete. But to hell with your demonstration. If they connect me to this, if they find out I've been funding your research, you knew what you were getting into. You wanted revolutionary medical techniques that would make the hospital famous. I delivered. By killing people. By creating conditions that proved my methods work. And they do work, Leonard. My techniques are superior. Once we publish the data, there won't be any data. I'm cutting ties. This conversation never happened. Voss turned to leave. Breslin grabbed his arm. You don't get to walk away. We're partners. We're in this together. We're nothing. You're a madman, and I'm the fool who believed you. Voss pulled free. Burn everything. Destroy the research. And if you ever contact me again, I'll make sure you spend the rest of your life in prison. The video ended. Claire stood frozen, mind racing. Voss wasn't just complicit. He was a co-conspirator. He'd funded Breslin's research, known about the attack, tried to cover it up after the fact. And the architect had evidence. Her phone rang again. Did you enjoy the show? The architect asked. Why are you giving me this? Because Voss is a loose end, a liability, and I don't tolerate liabilities. Consider this my way of cleaning house. You give that video to the FBI, Voss goes to prison, the hospital's reputation is destroyed, and everyone wins. Except Voss. Except Voss, the architect agreed. But he made his choices. Now he lives with the consequences. And what about you? What are your consequences? I don't have consequences, Captain. I have contingencies. And right now, my contingency is you. You're angry, betrayed. The people you trusted, Voss, Brenner, they all lied to you, used you, and now you want justice. You're trying to manipulate me. I'm offering you a partnership. Help me eliminate the corruption in your own backyard. In exchange, I'll call off the attacks. No more threats, no more danger. You get your life back. Claire's grip tightened on the phone. And all I have to do is work for you. With me, not for me. There's a difference. No, there isn't. She hung up. Immediately, she forwarded the video to Vasquez with a single line. Voss is compromised. Arrest him now. Then she called Colonel Reeves. I need a favor, she said. Name it. I need access to military intelligence. Everything you have on the architect. Every intercept. Every analysis. Every lead. That's classified. I don't care. I need it. Reeves was quiet for a moment. Why? Because he just made a mistake. He gave me evidence against Voss, thinking it would make me grateful. Thinking it would make me compliant. But what he really did was show me his pattern. He eliminates liabilities. He cleans house. Which means somewhere in your intelligence files, there's a trail. People who worked for him and then disappeared. Operations that ended in convenient accidents. He's been doing this for years, and nobody connected the dots because nobody was looking at the right pattern. You think you can find him. I think I can narrow the search, but I need data, a lot of it. I'll have it sent to your secure terminal within the hour. Claire spent the next 6 hours in the Fort Brennan Intelligence Center, surrounded by files and reports and intercepted communications. She built timelines, cross-referenced names, mapped connections. Slowly, a picture emerged. The architect had been active for at least 7 years, funding operations, orchestrating attacks, eliminating anyone who became a liability. But there was a pattern to the eliminations. They always happened in specific cities, always involved similar methods, always left behind the same signature, a cleanup so thorough it looked like the person had never existed. And all of those eliminations had one thing in common. They'd been investigated by the same private security firm. Sentinel Protection Services. Claire pulled up the company's records. Founder and CEO, Marcus Dray. Former intelligence officer, dishonorably discharged 15 years ago for reasons that were heavily redacted in his file. She ran his photo through facial recognition. Got a match. Marcus Dray had been at Redwood City Medical Center the day of the convoy attack. He'd been there during the press conference. He'd been in the parking garage when the hostile made his move. He'd been watching the whole time. Claire called Vasquez. I found him. By dawn, a joint FBI military task force had surrounded a luxury penthouse in downtown Redwood City, Marcus Dray's residence, his fortress. Claire stood in the command vehicle, watching the operation unfold on monitors. The breach team moved in fast, shaped charges, flashbangs, overwhelming force. But the penthouse was empty. No Dray. No evidence. Just expensive furniture and a single laptop sitting open on the desk. On the screen was a message. Well played, Captain Whitmore. But this game is far from over. Claire stared at the words, feeling a mix of frustration and grudging respect. Dray had anticipated them, evacuated before they arrived, left nothing behind. But he'd made one final mistake. The laptop's metadata showed it had been used to access a server farm 200 miles away, a facility registered under a shell company that led back to Sentinel Protection Services. We've got a location, Vasquez said. Should we move? Claire nodded. End this. The raid on the server farm happened at noon. This time, they found Dray. He was in the main control room, surrounded by screens showing surveillance feeds from dozens of locations, watching operations unfold in real time. He didn't resist when agents arrested him, just smiled. Captain Whitmore, he said as they cuffed him. I was wondering when you'd figure it out. Why? Claire asked. Why target me specifically? Because you're dangerous. Not because of your skills, though those are impressive, but because you represent something that threatens everything I've built. You save lives without asking what those lives are worth, without calculating the cost, without considering the bigger picture. That kind of blind compassion is corrosive. It makes people soft, weak, unable to make the hard choices. You mean the choice to kill innocent people for profit. I mean the choice to accept that some lives matter more than others, that sacrifice is sometimes necessary, that the world doesn't run on mercy. Dray's smile widened. But you'll learn, eventually. When you've saved enough people only to watch them waste the life you gave them, when you've seen compassion fail over and over, you'll understand. No, Claire said quietly. I won't, because I've already seen the alternative. I've seen what happens when people like you decide who deserves to live and who deserves to die. I've seen the damage, the trauma, The endless cycle of violence, and I choose differently. Then you choose extinction. Maybe, but at least I'll go down fighting for something that matters. Dre was led away in handcuffs. The server farm was secured, its data seized for evidence. It was over. 3 days later, Claire stood in a hospital conference room, not Redwood City Medical, but a different facility across town where Dr. Harmon had accepted a position as chief of emergency medicine. Tessa and Karen were there. So was Lieutenant Ethan Cole, now promoted to captain. And sitting across from them was Deputy Director Elena Vasquez. Voss has been charged with conspiracy to commit murder, funding illegal medical research, and obstruction of justice, Vasquez said. Breslin is cooperating with prosecutors in exchange for a reduced sentence. Dre is being held without bail, facing multiple federal charges. The architect's network is being dismantled piece by piece. What about the people he threatened? Claire asked. Brenner's family, the others who were coerced, protected, relocated. They'll be safe. Claire nodded. That was something, at least. Vasquez stood. There's one more thing. The Secretary of Defense wants to meet with you, personally, to discuss your role moving forward. What role? The one where you help rebuild combat medical training from the ground up, where you take everything you've learned, the good and the bad, and use it to make the next generation better prepared, safer, more effective. Vasquez paused. You've proven you're not just a medic, you're a leader, and we need leaders. Claire looked at the faces around the table. Tessa, who'd believed in her before anyone else. Karen, who'd seen through the quiet exterior. Harmon, who'd found his courage. Cole, who'd learned humility. They were all watching her, waiting for her answer. I'll do it, Claire said, on one condition. What's that? I'm not just training military medics. I want to train civilian first responders too. Paramedics, nurses, anyone who might face a crisis and need to know how to handle it. Because the skills that save lives in war zones can save lives anywhere, and everyone deserves access to them. Vasquez smiled. I think we can arrange that. 2 months later, Claire stood in a state-of-the-art training facility outside Fort Brennan, watching the first class of students run through a mass casualty simulation. Some were military, some were civilian. All were learning the same techniques, the same protocols, the same fundamental truth, that every life mattered and every second counted. Tessa had joined the program as a senior instructor. Karen had retired from hospital nursing to teach trauma assessment. Even Cole was there, having requested a transfer to medical operations. They'd built something together, something that mattered. Claire's phone buzzed, a message from an unknown number. She almost didn't open it, almost deleted it on reflex. But something made her look. You were right. Compassion isn't weakness, it's the hardest choice. R.K. Rashid Khalil, sending a message from wherever he'd disappeared to. Claire stared at it for a long moment. Then she typed a reply. Then choose it next time. She hit send and put the phone away. In the training facility, an alarm sounded. The simulation was starting. Students rushed to their positions, ready to face the chaos, ready to save lives. Claire walked among them, observing, correcting, teaching. Not barking orders, not demanding perfection, just showing them what was possible when you refused to quit, refused to hide, refused to let fear win. One of the students, a young paramedic named David, struggled with a chest tube placement. His hands were shaking. The mannequin's vitals were dropping. Claire stepped beside him. Breathe. You know this. Trust your training. I'm going to mess it up. Then you mess it up and you learn. But you don't quit. You never quit. David took a breath, steadied his hands, placed the tube. The mannequin's vitals stabilized. David looked up at her, relief and pride mixing on his face. I did it. You did it, Claire confirmed. Now do it again and again until it becomes automatic, until you can do it in the dark, under fire, with everything falling apart around you. That's when it matters. She moved to the next student and the next, teaching, guiding, building. This was her purpose now, not hiding, not disappearing, but standing in the light and showing others that the quiet ones, the ones who didn't need glory or recognition, were often the strongest. Because real power wasn't loud. It wasn't flashy. It didn't announce itself. Real power was showing up every day and doing the work, even when no one was watching, even when no one cared, even when the world tried to make you invisible. Claire Whitmore had been invisible once, a quiet nurse in a busy ER, unnoticed and unremarkable. But invisibility was a choice, and she'd chosen differently. Not because she wanted fame, not because she craved recognition, but because someone had to stand up and prove that compassion wasn't weakness, that saving lives mattered, that the people who did the hard work in the shadows deserved to be seen. And if being seen meant being a target, so be it. She'd survived worse. The training session ended. Students filed out, exhausted but energized. Claire stayed behind, reviewing the day's performance metrics, planning tomorrow's scenarios. Tessa appeared at her shoulder. You coming to dinner? Everyone's heading to that barbecue place off base. I'll catch up. Got some paperwork to finish. You always have paperwork to finish. Come on. You're allowed to have a life outside of this. Claire looked at her friend. This woman who'd seen her at her worst and her best and never wavered. Okay, dinner, but I'm not staying out late. We'll see about that. They walked out together into the evening air. The sun was setting, painting the sky in shades of orange and gold. Behind them, the training facility stood ready for tomorrow's students. For the next generation of people who would choose to save lives instead of taking them. And somewhere out there, threats still existed. People like Dre, like Breslin, like all the others who saw compassion as a target and kindness as weakness. But they didn't matter. Because for every person who chose violence, there were 10 who chose differently. 10 who showed up. 10 who did the work. 10 who proved that the quiet strength of a healer was more powerful than the loud anger of a destroyer. Claire had learned that lesson the hard way. Had been dismissed, disrespected, hunted, and nearly killed for it. But she was still standing, still teaching, still saving lives, and she always would be. Not because she was perfect, not because she had all the answers, but because someone had to. Someone had to believe that every life mattered, even when the world said otherwise. Someone had to stand up and be counted. And Claire Whitmore had stopped apologizing for being that someone. She'd spent years trying to be invisible, trying to hide from her past, from her skills, from the person she'd been in the war. But the truth was simpler than she'd realized. You couldn't hide who you were. Not really. Not forever. You could only choose what to do with it. Claire had chosen. And she was never looking back. The end.